and gentlemen, we will bring the inquiry into order. I acknowledge two members who are here. Honorable. Sorry, I'll start again. Governor Simbu and our team from Simbu, thank you for your patience. Ladies and gentlemen, we will commence our inquiry now. I want to acknowledge our two members of the committee who are here. Honorable Solon Loifa, member for Meniamia, Vice Minister assisting the Prime Minister. We also have a member for Karamui Salt Namane, Honorable Francis Yori Alua. Is also Vice Minister for Justice and Attorney General, yes. With his background as a lawyer too, it's appropriate allocation by the Prime Minister to assist the Attorney General. But let me start with a word of prayer. I will ask a member for Meniamia to lead us with a small word of prayer. Thank you very much, ladies and gentlemen.
Thank you. Let's pray. Heavenly Father, Lord, we thank you this morning. Thank you for the gift of life and to live another day. This morning, Lord, we commit our deliberation and inquiry into your hand. We commit our chairman and all the members and all the participants back to your hand today. May you lead us in our discussion this morning. In Jesus' name we pray. Amen.
Amen. Thank you for the prayers, member for Meniamia, committee member. Ladies and gentlemen, I will invite our member for Karamui Salt Namane to give a bit of opening remarks to start our inquiry for today.
Thank you, Chairman. Morning, ladies and gentlemen. Special welcome to my good governor and his PA and CEO from the team from Chimbu, our friends from UNICEF. We had a productive meeting yesterday with representatives from National Department of Health, National Planning, from the Office of Community Development and Youth. And I think proceedings this morning, I think it's confined to provinces and not as federal program. I think I would start with Chimbu this morning, and I thank you for your punctuality this morning. The Special Parliamentary Committee on Children and Youth is set up by Parliament to inquire into social services for vulnerable population, children especially. And I think our friends from UNICEF and the other NGO groups will tell you, based on the data that we have, I think PNG is doing very, very bad in terms of the indicators on comparative basis with other third world or development countries. So it's a very big ask. And it requires all government departments, all stakeholders to at least raise the stake. And based on the deliberations, submissions, the committee members and the chairman will put a report into Parliament as to how best we will address these issues. So the inquiry provides an opportunity for us, the committee members, to get feedback from all stakeholders, all government departments, every other agencies that are involved in advancing and promoting the interest of children. And in the questionnaire, I think that's been sent out, I think by governor and the CEO from SIPA, I think there's some questions that's been posed there. So once you take the flow in course of responding to these questions, then you respond to the, I think from what I'm seeing here. Hang on. They're about, but 9 questions. So respond as best as you can. If you have any written submissions, you can turn it up. We will take that as part of the property of the committee, and then we will do from there. But I leave it now. The floor is open to my governor and Dr. Kasi and the PA. Thank you.
All right, thank you, our member for Karamu Solomon, Vice Minister. Governor, Honorable Noah Cool, you and your team have the floor. Please, for the record purpose, you can introduce the PA and our CEO. So it's all recorded. All of the proceeding is recorded audio and also is going live stream. So please, you can, we start now. You have the floor.
Thank you, Chairman. Good morning, everyone.
Good morning.
We are humbled to be here this morning. In Simbu, we believe in partnership, collaboration, and consultation. So this morning, as you can see, I'm not alone. I bring my provincial administrator, Mr. John Punde, my PHA CEO for Simbu, Dr. Ken Kasi, with me. I'll try my best to answer all the questions. And if you can ask some questions, my technical officers are ready to answer all these questions. Thank you, Chairman and Parliamentary Committee on Children and Youth for calling us for this very important inquiry. You want to know the status of children, well-being, and youth social services. Whether we are doing something about these vulnerable people or not. I wanted to say this morning that we are receptive. In the province, we are receptive to all these developments taking place in our province. Starting the next 50 years, you are now taking these important steps of check and balances, something that has been lacking for the last 50 years. I salute you all on behalf of my people for seeing this need to strategize a way forward, something we have been missing. Who will check the plans? Who will check the budgets? Are they reasonable? And the achievements, taking the appropriate institutions to task. The country needs to progress, not maintenance. We need to stay focused, not complacent. Too many political interferences, inconsistencies, abuse is rife in all sectors. While I have the mic, let me ask this question too. Is CICC or the plasma providing advice to the government and its agencies too? Or are they not functioning anymore? We are seeing a lot of things going wrong. Anyway, I wish more committees can do things you are driving now. With this, I will go straight to my slides. It's a presentation by the provincial government to the Special Parliamentary Committee on Children and Youth. It's a snapshot of Simbu province, provincial capital. Its population is around 535,000. We've got 6 districts, 20 LRGs, 18 rural and 2 urban. We have 311 wards. We have the major tourist attraction. We have the highest mountain. It's in our province. It's 4,509 meters high. Major economic activities are coffee and fresh produce. We are renowned for farming. The land mass is 613,000 square kilometers. This is the outline. Social service for children and youth. One is the provincial immunization, the polio campaign coverage, outreach and staff strategy, nutrition stunning reduction, up-to-date data to SPC and CY. Support received from national agencies. Provincial immunization, number 1 point is provincial immunization and polio campaign coverage summary. On the 15th of May 2025, Simbu Province launched its polio campaign round 1 and round 2 on Tuesday, 12th of August, or round 1, on the 12th of August 2025, with all stakeholders present, and it was concluded on the 28th of September 2025, rolling out to all the 6 districts. We have achieved Simbu provincial coverage of 83%, just like last year. We're very consistent. Round 1 covered 43 health facilities, and 43 health facilities. 3 health facilities are air access zones. That is in the southern part, which is Karamwi, which will be covered in round 2. Round 2 polio rollout in Simbu will commence this month, 2025. This will include other immunization activities as well. We are thankful for our partners such as World Health Organization, who gave 468,000. UNICEF, who gave 158,000. The Impact Health or World Bank gave us 1,283,000, and for the Kina. We really appreciate. The summary: 83% immunization polio vaccination coverage rate in Simbu Province and coverage. Solnomane Karamui, 80% coverage. Gumini, 75% coverage. Chuabe, 74% coverage. Windiawagiambo, 73% coverage. Sisilia Umuk, it's 73% coverage. Why we have this percentage? You can ask the questions later. Number 2, outreach and staffing strategy summary. Simbu Health Service reaching out to levels of children, young children, pregnant mothers, adolescents through outreach activities to all communities and lower level health facilities are under family health coordination of the Public Health Directorate in collaboration with Obstetric and Gynecology Department and Pediatric Department. These are health terms, and it's they can understand. In 2024, outreach activities for the province was 108. And this year, it improves to 156 from January to August 2025. The current staffing ceiling is 631 out of 800, which is not enough, as almost 1,900 staff is required based on forecasting. Therefore, our human resource strategy are to do short-term internal hiring and also internal advertisements, which was approved for 2026 restructure. The outreach activities and HR activities are funded under government recurrent budget and other support coming from World Bank, WHO, and UNICEF. Number 3, health and nutrition. The World Bank funded child nutrition and social protection CNSP signed on 31st July 2024 by Simbu Provincial Government and the 3 implementing agencies. 1 is the National Department of Health, NDOH. 2 is the Department of Youth, Religion and Community Development, DYRCD. And number 3 is Department of Justice and Attorney General, DJAG. The nutrition programs implemented: nutrition and stunning reduction summary. The nutrition program implementations are carried out by both public health and curative health directorates, respectively, a stunning 48%. 48% is one of the worst indicators we have globally, and malnutrition is a challenging indicator. The malnutrition indicator has satisfactorily dropped this year, and the dropping trend is good. However, the low birth weight indicator is increasing despite being in the expected target zone. Factors influencing this are challenging: antenatal visits, supervised delivery, nutrition before pregnancy, and we are observing a rising trend of teenage pregnancies. With CNSP, all these challenging factors mentioned above have been addressed with community and stakeholders. NDOH, DYRCD, DJAG, they are all engaged. All CNSP activities and reports are with the CNSP technical team leader in Component 1 and Component 3. We thank the World Bank, who has funded with over $90 million USD across the country. On food security, the Department of Agriculture and Livestock has signed an MOU with Simbu PHA to deliver these strategies in food security measures. We have other issues, but this is from the health sector. We'll advise later in the presentation. Number 4 point is up-to-date data to SPC CY, early childhood education. Early childhood education. The changes are intended to increase accessibility to primary school education and discourage school dropouts at the end of grade 2, grade 6, grade 7, grade 8, and grade 10. They are all to move forward to complete their universal education after grade 12. The entire student population who start at preparatory will continue to grade 6 and on to grade 10 and to grade 12. There will be no dropouts. And Simbu is no exception. We are one of the who is going to benefit from this policy. Simbu has already started the implementation of relevant education policies, so we get the desired retention outcome of the basic universal education soon. Patient out of elementary schools under current 166 reform. Yesterday, the Education Division came and did a presentation, but I think the presentation, they did not cover all aspects of it. As a teacher background, we can see we might not realize this in the next 5 years. But in Chimbu, we have already started a program. 80% of our schools already phased out elementary. And they are enrolling grade 1 and 2 into the primary schools. We have now grade 1 to 6. In accordance to 166 restructure policy from previous structure. We are the first province to implement it. We already tried it. Current number of teachers we have is 3,356 teachers. 388 elementary schools. We've just still got that number. They are still on the payroll, but they are not active. 188 primary schools with 25 high and secondary schools. 2 major reforms. Restructuring of 364 to 166. That we have already tackled it head on. So this will involve giving recognition on the importance of early childhood development and the introduction of kindergarten 1 and 2. And we have already got some institutions in Simbu. And we are yet to come with a policy to pace out or to encourage them or to give them a standard qualification or whatever. So you see, we are just all over the place. Increase the number of manpower positions from. Okay, while on the patient out 166 program, we've got a big problem. When you pace out grade 7 and 8 to high schools, it's putting more pressure on the high schools and secondary schools. We need to build more dormitories. We need to build more staff house. We need to build more classrooms. So you see, we've got a very big problem, but we already committed 13 point something million this year for this, because we are taking this add-on, this reform add-on. Okay, now we go to child and youth protection summary. Increase the number of manpower positions from 1 to 2 per districts to respond to child protection issues. At the provincial level, we created and funded a child protection officer position, which is now under recruitment process. The current budget is a budget line for International Children's Day commemoration, funding annually, while funds are also available in welfare support services. Partnership effort. However, efforts by our CSOs and FPO are acknowledged for reaching out and being the agent of hope for the survivors. Marginalized children, especially children with special needs, are also considered, and we can acknowledge them. Continue child protection summary. The province has also created a funding position for disability officer and funded this in the recurrent budget. NGOs like the Catholic Church, human rights defenders are very conscious of children in this category and have services that suits their needs in our province too. Create public service position for a juvenile justice officer to respond to children who come in conflict with the law under newly Law and Justice Division, with funding being made available in the recurrent budget with its own budget line. The administration also has funded a juvenile cell block at Kundewa police station, which has been built and will open soon. That is for our vulnerable people. They can go and sleep in the same cell block as the adults. Youth support programs. Active participation by SPG with Department of National Planning to implement the National Compulsory Service Policy in the province to address rising youth population, youth buggle. Support to youth participation in sports activities, all kinds of sports. But currently, I think all the districts are playing rugby league. All the districts. We brought them down to the districts now. And they'll be playing the grand final this Sunday too. Other sports, we've supported them. One of our kickboxing is the champion in world kickboxing on the world stage now, so we appreciate it. And we are working with them, supporting them too. Plans to introduce a youth rep in the Provincial Assembly in 2026 to be the voice of youths in the province too. Support to youths engaged in the informal sector, SMEs, and other things that they want to do, we are supporting them. Second chance youth education, training, and upskill programs. So we are sending them to institutions where we can train them to become skilled person. Vocational schools, other private schools, and things like that. We're funding them with the little money we have. We can't fund all the institutions, but a few selected ones. Support to youths to be actively engaged in community civic programs. Like we are engaging them for a town, clean-a-thon, town activities. We are engaging them to become reserve police and other. Number 5, support received from the national agency. These are the people who keeps us going. That's our heartbeat. So RSDP, we thank the DPLG and the World Bank for coming on board in Simbu. I think 7 provinces were selected, and we are one of them. We are one of them we selected. And they are trialing out in 4 LLGs, and they've got 53 projects at the world level.
Value of 6 million.
They funded 6 million. And we supported them by giving them another 500,000 on top of that. It was partnership with them. And they've got 9 water supply projects. 4 community empowerment projects like piggery and poultry and things like that too, to boost their nutrition and livelihood and things like that. Some 4, I think 5, 6 community halls, staff houses, classrooms, was funded by RSDP. And because we supported them, they are going to bring it out to all the 22 LLGs in the province next year going forward. So it's going to make a lot of impact. E-word diesel, word recorder book, we thank the DPLC for that. That's the extra money that is coming in. Digital Bilum platform, we thank the Australia and the IRD for coming on board. It's very active in Simbu. We are working with them. Mother's Nutrition Program, the World Bank, we said thank you. UNICEF, we said thank you for coming on board in Simbu. I think we did for one LLG. Now we are trying to spread it to the whole district for Kundeo Gembok. And they are helping the mothers with money for their nutrition meals. SME training, Macro Bank, Department of Commerce and Industry is coming on board to train so that they can empower the mothers and other people so that they can have money in their pockets. They can buy the things that they need. Simbu River Fish Meal Factory is an initiative by NFA in partnership with us. So we can have we can supply all the fish. People can have access to fish. I think it's the first of its kind that we are producing the fish meal for the fish in the country. So this is a good nutrition for the families. So whatever is left over, we can make money from it. Otherwise, it's a good protein source. And it is said also that when you eat a lot of fish, your brains become clearer. So it's good for the kids, small babies. Fresh Produce Agency, they are working with us. The community approach working with us, so we can produce the fresh produce. And we are selling them, we are consuming them. So now you can see a variety of fresh produce from the organic fresh produce. It's good. And we are marketing them in Simbu and in Goroka and Leh, Morobe, and even getting them to Medeng so that people can have access to this fresh produce. CIC Coffee Industry Corporation, they are also receiving support. They are building roads. They are also organizing dryers and things like that, so it can empower the people too. So when they have the money, we are looking at a bigger, holistic approach. We're not looking at a the current initiative to refocus in our province, administrative restructure. We are advertising positions now. We are trying to increase it from current 299 public servants positions to 525. And already we are progressing that. So by next year, we should have extra positions in our public service. These positions will spread to the districts so they can empower the people in the districts and they can do the jobs that nobody has done. So holistically, we can address all the underlying issues that we have in the province. Restructure new divisions such as information systems, special interventions, M&E units to divisions. All this, we are doing that. Disaster and climate change, these are the new committees that we have in the province. As new challenges come on board, we are on top of it already. Small provincial business arm, we are trying to do business ourselves now. Governors have been very vocal on this one. We want to empower the people. At the same time, they will empower the business arm. So it's a two-way thing. We want to get really organized. So we are going into that so that we can be economically independent and we can address some of the issues, many of the issues that underlying issues that we have in the province too. Connectivity programs. National government is doing connectivity programs. In the province, we are doing connectivity programs with our little funds. No support with our funds. We are building bridges, and then we are trying to connect all the other roads like Karamui, which is a flying district. We are trying to connect, and the government has come on board. So we are happy. We are working with them, and by the end of the year, we should build a bridge across the Wagi Bridge. Now they are starting. At the same time, we are trying to connect the energy. It's a big problem in the country. We are trying to connect the energy. So we are also starting Karamui hydropower project. It's going to be 2,500 megawatt. It's going to be the biggest. And we're going to solve the power problem in Papua New Guinea too. And it's a win-win. We help the country. At the same time, it will empower our people to have money in their pockets and do the things they want to do. Education infrastructure rollout. In 2024, we spent 13.7 million focusing on building infrastructure to accommodate the 166 reforms. We have already done that. We are headway. Because we can see lack of staff houses. High schools will have lack of staff houses, dormitories, and classrooms. Police reserve training and logistic support to take back Simbu. We are also going into, we want to make Simbu a peaceful place. So we are engaged in, we already funded the police. We don't know when they want to start, but we want to engage the young people to bring law and order. So all the other things.
Take back Simbu.
Yeah, we want to take back Simbu.
Yeah.
That's right. This is one of our projects. Take back Kundiawa town, take back Simbu.
Yeah.
Funding inconsistencies. These are issues and challenges that we have. Funding inconsistencies. For last year, we got 40% of our national funding. 40%.
Just 40%
40%.
of the entire functional grant.
Correct. Now it might be between the 40% to
It's about 26%.
about 26%.
And we are in October.
We are in October. So you see, we appreciate what the donors are doing. We are not doing anything ourselves in the province. What little we have, we are trying to support them. Diversion of appropriated budgetary allocations to other non-priority areas outside of the plans and programs. That's the challenges, issues. Lack of consistency in resource allocation and budgetary support. Concentration of programs and government activities in Waigani, thus stopping the provinces and limiting implementations mechanisms at the provincial levels. No consultations, and we lack check and balances too. Some are sleeping on the jobs. Some processes are very slow. This is norm. It's affecting the service delivery in the province too. Way forward, we want to forge strong partnership, have consultations and collaborations at all levels of government and development partners. As you can see, my PHA CEO is here. You can see my administrator is here. It's my turn to come and do the presentation, but they are integral part of my administration, and they need to be here. So you see, these are kind of things that we want to. So we want to forge partnerships. So we have collaborations consultations. So we can try to move some of the agendas that is pressing us. So we want to continue this one. We've already did a program here. We have reached out to all the multinational organizations, embassies. We already reached out to them. We are giving the invitation, and some of them are working with us now. They are coming on board because we can't do things alone. If we did a big presentation at Gateway Hotel early last year. Number two, implementations of Provincial Youth and Children Council in 2026 going forward. So all the plans that they do for the youths and children, or for other plans that we need to accommodate, we believe that if only they can come and we can work together in partnership, we should have consultations so we can implement it in our province. Why are they putting it in Waigani and the buck stops there and expecting us to do things up there? Number 3 point, appointment of a youth representative in the Provincial Assembly, which has been lacking. Women are there already. But the last one is increased allocation of funding to address children, it's not the last, increased allocation of funding to address children and youth plans. Second last one is the increased staffing in our PHA and provincial administration. That's the way forward for. Currently now we are sort of manpower, so who's going to do what? We want to empower the local people, but we don't have people on the ground, DPI officers on the ground in the districts to carry out these programs. We can't work with the FEDA and with the farmers only. There's got to be some people there who are giving them supervision. So that's why we are increasing staffing. That's one of the examples. Even our PHA is trying to increase its staffing so we can effectively address all the issues that is coming our way. And the last thing is strengthening our partnership programs with churches. In Simbu, we dedicated the province back to God already before we passed the Christian country policy in Parliament. We did already. We are paying our 1/10. We are buying vehicle for the body of Christ in the province. Body of Christ, we have it for the province, we have it for the districts, we are replicating it to the LLGs now. We want them to take the active step to move forward, and they can address the issues that we are facing. We can't do it alone. We need partnership. So this church organization, we are giving them priority. 1/10 of our PSIP, 1 million, we give it to them. 1/10 of our internal revenue, we give it to them. So in that way, we want to strengthen this partnership. And I think this is the way forward. This is the way forward. So on that foundation, we are going to build our province. And I believe good things will happen and good things do happen. So it will come our way. Thank you very much.
Thank you. Thank you, Governor Honorable Noah Cool, for giving a very comprehensive report on your province and in the areas where our committee is responsible or have oversight according to our terms of reference. You have in fact gone beyond our priority for this inquiry now, which is focused on children. We, under our terms of reference, we have oversight over youth too. So I'm very pleased on behalf of the committee that you and your PA and CEO for PHA here, you have given a comprehensive account on both children, youth, and also into other, social and economic indicators or plans that you all have. So I thank you on behalf of our committee. Before we open it up or maybe we'll give an opportunity to your PA if your PA want to back up anything specific. and the CEO of the Simbu PHA. Maybe if they want to say anything that specific or more particular.
Okay.
But you want
Chairman,
to end up that.
Chairman,
yes.
I've got everything here.
Yes.
I just summarized
Yes. Yes.
my presentation, but everything is here. We
Yes.
can present this one to you.
Yes.
And then when you have any particular questions, you can ask the two
Yes.
technical officers.
All right. Perhaps our technical team can bring it
Yeah.
over.
Thank you.
Thank you once again, Honorable Governor.
Thank you.
Before we open up for questions, just for generally for us, I just want to highlight some of the statistics that are more particular to children in our country, and which our committee is have the mandate to have oversight over all the national departments and state agencies, and of course down to the provincial and local level government and DDAs, and right down to all of our villages. So just to give us an oversight of the indicators that relate to our children at the national level. In respect of immunization, a program regarding DPT3 and Penta3 immunization coverage in 2024, Papua New Guinea at the national level up to children 5 years old, the coverage was only 47%. Child malnutrition all around the country indicates there is a 48% age 5 children who are stunned. That's affected by poor nutrition, resulting in malnutrition. So it's almost about 50% of our children are lacking good nutrition. Some are affected by malnutrition. So this should be a major concern to all of us. And our committee is, charged with getting all of us to take action at the national level, provincial level, at the local level, right down to the community, that we must take action to change this around. What we have set out to do is the indicators. If you are red, then you are in the lowest point. And if you go green, then you are reaching the highest level of achieving outcomes. So the goal for our committee is to turn red into green. To work with you all, Governor and your team in Simbu, all the provincial government, but equally at the national level. And our committee take notes of the point that you raised in terms of funding. To get just 30% this year, we are now in October, and 40% last year, functional grant, that's
Problem.
26 this year, 26%. So that's very damning indicator of the relationship between national and provincial government. So that's something our committee will take note of, and we will report to the Parliament as soon as possible on this type of impediments that stops all of us from reaching the outcome. In terms of education, net enrollment rates for 2019, some of this data is a bit a few years back, but this is the data that we have up to now. Elementary level, 85% only enrollment. Primary level, nationally, 58%. And the migration to secondary level is only 20% national-wide. So you all can start to see what is happening to our children. We need all to turn this around. Foundational learning, data from 2021, minimum proficiency in reading, that's 34%. In numeracy, 23%. These are the national, indicators, not the provinces. We will go to the provinces later. Bed registration in 2024, only 13%. So many children are not being registered, and that should be a concern to all of us, to the provinces, to the LLGs, DDAs, and of course at the national level. Me, I was born in the 60s, so I got a birth certificate or registration by the Australian government. So that's in the remote, last frontier of Papua New Guinea, in Manus province, southwest Manus. So during colonial time, they were able to register us. So I've got a birth certificate from the Australian colonial government. So we're not doing very well, 13% nationally. We have a big problem too with child marriage, underage, meaning below 18. Girls especially, they have dreams and hopes and aspirations just like everybody else, but some are compelled directly or indirectly to get married below 18 years old. They are not mature yet to decide what is good for them. Maybe parents or some other peers or whatever is happening. 27% young girls being forced to get married below age of 18. Violence against children, gender-based violence. National level, 75% children experience physical abuse. 85% of fathers reported hitting their children. 28% of girls 15 to 49 had experienced sexual violence since the age of 15. That is a very bad statistics. We need to turn this around immediately. 40% of the total sexual abuse reported case in the country are children. 40%. Basic water services 2020, 45% nationally. People have access to good clean water. It's divided in this way: 39% in the rural areas, 86% urban areas. Basic sanitation access 2020, 20% urban areas, 15% rural household, 60% use improvised sanitation. Open defecation, just doing it in the open. Very unhygienic, 16% nationwide. So, Governor and our team from Simbu, this is a very bad statistics on the part of the entire country. So, it can only change when the provinces and the provincial government, you all take responsibility and come up with the plans and strategy and implement those strategies to turn this around. If we want to make the next 50 years better for our country and our people, it starts with the children. So this is why, as I mentioned yesterday on behalf of the committee, that the Parliament has made a big statement by setting up this committee. We need to give a better chance to our children for the next 50 years. Governor, you and me and all my committee members here, they are mainly first term, so they probably go with our children to 2075. You are a rugby league player, so you're still strong too. So maybe you go to 2075 too.
Yeah.
The next 50 years is for our children.
That's right.
By 2075, they'll be 50. So what we do now, what you all do at the provincial level and we all do at the national level, will really define whether they will have a great life and there'll be a big celebration better than this year in 2075, or the statistics will be the same. So this is why we are called to take responsibility now. So Governor, before I open it up for question time, I think there's something I want just to mention about Simbu. The acting Secretary for Health yesterday gave us this 2024 provincial and district health profiles. You people are looking for news or not? Yeah, okay. So CEO has seen it. So it's divided into the district. So what we intend to do is, at our level, we will send all this data. Our member here, all these members too, it reflects on them too. So we will send this data directly to the members, so they will start taking leadership. So there's some indicators there. I just want to, for the purpose of our dialogue now, I just want to give you the UNICEF data in respect of Simbu province, our province of Simbu, up to May 2025. The data may have changed, but this is what the data that is before us. So percentage of children receiving DTP3 vaccination up to May 2025. Governor and your team, your province is rated as between 30 to 49%. That's the lowest is up to 30% in Medang province. So that's in respect of that particular vaccination, DTP3. Percentage of improved water supply up to May 2025, Simbu province, there is no data. So if you have provide this data now, that will be good. Huh? Because water supply, as we all know, CEO Simbu PHA, water supply PA, is very important for welfare of everybody generally, but for the purpose of our committee, the children, they need to have access to clean water, safe water, otherwise it affects their health, it contributes to malnutrition, poor nutrition, and their life journey will just be affected at the early age. Percentage of coverage of deworming, PHA CEO. From the data here up to May 2025, Simbu is rated at 30 to 49%. If you all have a deworming program too, it would be good for you to help our governor to highlight this. It's an opportunity for you all to Simbu to showcase what you all have been doing generally, but more specifically for our committee, All Pigninia, very important All Pigninia. We have to shine the spotlight on our children. They are the future. You may have sunset di wako kapape. You plus supply stuff yet, but you plus supply sunset di wako. All right, in terms of percentage of out of school, and this is very important for governor, for you, PA too, Simbu, you know, among the other resources that you have, education is one of your very important resources, manpower development. Out of school children by the age of 15 to 18, Simbu, you are rated as between 50 to 89. So, out of school children, yeah. Yeah. Yes. So, those are some statistics that I want to remind you, Governor, and our PA and CEO Simbu PHA. Yeah. Otherwise, on behalf of the committee, I thank you, Governor, and your team. You've given us a very comprehensive report. I will open it up for any specific questions, and then we can bring our inquiry with you all to an end. It's as you all can see, we're just starting, so we want to create, you know, the initial impression.
Yes.
Get our data and information. Then for future inquiries, we'll start going to specific. Our mandate, as I indicated, is to hold everybody to account. What are we doing for our children?
Correct.
And looking at all the indicators, immunization, nutrition, access to water, birth certificate, education, health. Of course, there are the indicators we will start to focus on too, but I can see, Governor, you all have a comprehensive plan and program reaching out to children and youth, so you all doing well. And in terms of early childhood too, that's an area too that our committee is charged with and have oversight, so I'm pleased that on behalf of our committee that you all have made progress in rolling out the early childhood. I think they are, from the Department of Education yesterday, they are still in the planning process. They're still working it out, and it's not an official policy yet or part of the proper plan of the department. The teachers, you may not say, where are they going to get trained? University of Goroka, or you yet by training the province
That's right.
you, or and then they've set the minimum requirement as grade 12 and diploma. So it's like the Department of Education is just doing trial and error, or as usual doing guinea pig type.
That's right.
They're probably not a comprehensive sort of a policy analysis.
Correct.
And like they're changing before top down, top up, And I can say this because I used to be chairman of the Waigani Primary School during the elementary time. They said, you all have to bottom down and top up. Hey, where will I get a classroom? I don't have the money. So I had to buy canvas from Brian Bell to set up the tents for,
The
elementary
7 and
1,
8.
2, and 3. And then I have to bring in 7
7
and 8. I had no money at Waigani Primary School. But somebody at the National Department of Education said that we have to top up and bottom down. So this is a type of like a guinea pig type of operation. Anyway, but minister and secretary, they say they're doing some pilot projects. So in NCD, we are piloting this early childhood education. So it's good they pilot it in some areas and then we can roll it out. But it's good that in Simbu you all are already taking ownership and rolling it
That's
out.
right.
I open it up for question. Committee members, any question? Yes. General question or specific question? To the governor or provincial administrator or the
Yeah.
CEO of the Simbu PHA?
No, I think, but firstly, thank you, Chairman. Firstly, good morning to you, Governor.
Morning, through.
And you did a very comprehensive report, status update of your province, and you seem to be doing really well in these very difficult times.
Thank you.
Because you have a very good technical team behind you, so
That's right.
I acknowledge the presence of the PA and also from for the CEO. I'll just start with one, and then we can pick up as we go. My question is related to maybe the PHA CEO can just provide some information on that. With regards to WASH, that would be regard to WASH, and there is a program from the National Planning Department under the Project Management Unit. There is a WASH unit. Yesterday they say they have partnership with the Department of Health and to roll out or to support the Department of Health in terms of LT Island concept. So I'm just curious to find out whether Simbu Provincial Health Authority have such program, LT Island concept, and your relationship, your partnership with the national planning. Are you having some sort of partnership with national planning, the WASH project management unit under national planning, and your also relationship with the National Department of Health in terms of community island, LT Island concept and WASH? If you can provide some more details on this one.
Thank you, Chairman, and the panel of the Special Parliamentary Committee on Children and Youth, Children and Youth, and thank you to my governor for a comprehensive report representing the Simbu province. Firstly, I make mention of the legislations. Before we used to have the Simbu Provincial Rural Health under the Simbu Provincial Administration by the Organic Law on provincial and local level government. Now we have the PHA Act taking over the health of the province. So under the PHA structure or PHA implementation, looking after the health, particularly in Simbu province where we are representing now, we have the curative side that is looking after the level 5, that's the provincial hospital in the iconic Kundewa Provincial Hospital, and doctors and nurses service at the hospital. Then we also have the public health. The public health look after the public health programs, particularly in the area of prevention and primary care of the population, down at the village, up to the council, ward council, and up to the LLG and the district. So in the public health component of our health service, we have the environmental health. Environmental health is not in the area of primary care, as in curative, giving medicine and injection, but it's in looking after the environment to provide good health back to the population. And that's where the LT Island concept comes in. It's not a new concept. It was established or was introduced in 2013 or 12 and when the PHA took over, we had two areas in Simbu that are implementing LT Island concept, and we want to make that as a pilot for the whole of Simbu, roll out to all the other villages, 134 ward councils in Simbu. So it's something that was already taken on board in the system of PHA. However, the kind of recurrent funding that we have for implementing these environmental activities, it's broad. We're talking about the wash, as in the water. Water must be there in all communities, not just in health facilities, in all communities, clean and safe water. But in health facilities, we would want uninterrupted water supply. Mamasakam karim pikirini, also come marasin drink. So uninterrupted water supply, not just uninterrupted water supply, but clean water too. And then hygiene and sanitation comes in. We are rolling out the program of building incinerators across the district. And the Healthy Island concept is something that is constrained by budget. But in this year, we're looking at rolling out the same for the two already pilot area. One is up at Gembog, and that's where one time if the team visits, we'll go up there and see. It's where the people is so independent themselves. They have their own water supply, they have their own supply system, and they are living in a state where health is minimized. Health issues or health hazard is minimized greatly. And that's something that in the health system in the country we need to look into, because this was something that was done before people used to go with chemicals to the community and spray to kill mosquitoes and kill other harmful bacteria in the water, so there is no typhoid, and now these things are coming up. But when we introduce the LTI concept, this will cut down on the big burdens of the disease that are coming to level 1, level 2, and primary level. So
thank you. So that's really good to know. Okay, you mentioned that you have budget constraint in implementing, especially the healthy. That's a community-based preventive health, where public health. Preventative health, public sector, public sort of health, where communities will be involved. So the people with the community, especially leaders at the community levels, councillors, presidents, and DD members of parliament. I just want to find out, do you, as a PHA CEO, and do you have you build a partnership with the, because this is a project that I think WASH and LT Island Concept, it's a project that I think LLGs or DDAs can run with it, instead of running at the provincial level as a provincial project. It can be run at LLGs or DDAs. So as a PHA, are you building any partnership with your districts or your LLGs in terms of rolling out these public health or public health programs?
Yep. Thank you, Chair. We have partnership with DDAs. Currently, only 2 DDAs, Chuawe and Kundewa Gembog. That's before the court, so we don't have a partnership with Kundewa Gembog. But with Chuawe is one that we are developing into, and SSY. Otherwise, the others, Soltnomane, Karamui, Gumini, Kerawagi, we have partnership, DDA, recognized DDA partnership.
So what sort of recognized, what sort of partnership? Is it the MOA, MAU, or TOR, or what sort of?
It is an MOU.
MOU between the DDAs
Yes.
and the PHA.
Yes. Guided by the Department of Health on establishing those legislative partnership.
So I'm really curious on this partnership. So in that MOU, you identify what type of service DDA should provide, what sort of projects, I mean, programs like immunization, malnutrition, also those are the things that this committee is looking after,
Yep.
I mean, concern over. So in that partnership, understanding, there's a role that a DDA should provide, run with it, and
Yes.
provide support.
Thank you, Chair, and thank you, panel member. The partnership contains all those programs that's supposed to be run down at the district, all the way to the ward council and village, particularly in the infrastructure and in those little service area. We provide a technical support to the DDAs to establish those services based on health standards.
Okay, I think your MOU and all this, Chairman, through you, I think we should have a copy of that MOU and ask if all the other PHA have such MOU in place. So I think we can. So we can also find, because I'm from the district level rural area, so they seem to be missing sort of programs with the Department of Health, PHA, with the guys we at the rural and community level.
Yeah.
So if it's working well with one province, what are we doing not right in other provinces? That would be a good area so we can look at. So maybe, Chairman, through you, we can have a copy of the MOU, so you can ask other provinces or administration if they have such partnership. Thank you, CEO.
Thank you, our member for Wawaria. Governor, perhaps I will ask maybe yourself or your PA. Yesterday we have a situation with the Director, Children and Family Services Office, I think, Office of Children and Family Services, and Secretary Community Development about setting up of the National Children and Family Services Council. This is a council that is a requirement under the Lookout in Pignini Act. And the Lookout in Pignini Act was passed by Parliament in 2015. Now, it coming up now, there's not, the National Council has not been set up, and they've never had any meeting. In fact, they just met last week for the first time because we gave them notice, as I can see. And we sent out the questionnaires in order to prepare for this inquiry. So it might have compelled them to have the first ever National Council meeting last week. And that's a record that we should be ashamed of. 10 years to set up a council. And this council is important to have oversight over all the indicators regarding children, all the indicators that I've just indicated to all of us regarding our work of our committee. Governor, have you, maybe your PA can help you.
Yeah.
Have you and your team in the province been briefed on this Lookout in Pignini Act and the requirement of that act? And more particularly, are you aware of the requirement to set up a Provincial Children and Family Services Council? And if you have been briefed, what steps are you all taking to set up that council? Because that council time may come up at the provincial level. And by monitoring all the indicators from all Pignini, and then they'll be reporting to you, and they're reporting to the PA and reminding the CEO of the Simbu PHA that these are the indicators, you have not taken enough steps yet. What are you doing? They will be holding us to account. Then we all will be, putting time and effort and energy towards improving attention on all Pignini. Right now, PA is managing everything generally, but the law wants us to be specific, which is a good strategy. So you play talk out this. They came and synthesized or brief you on this law. It's just in Waiganina. You may foul this Tablo province. PA.
Thank you, Chairman, and the members for the opportunity to come and discuss all these pressing issues, as we all appreciate. Having a brighter future depends very much on having a healthy youth population, as well as also taking control of the nutrition and all this that goes into developing a full, complete, healthy human being. So I think this process, after 50 years on, I think that's the right path to take anyway. If we are serious about getting this country right in the next 50 years, because we need to invest in the right areas, and that is to look after the future, that is the children, and condition them in right environment and life. And in terms of policy level, I think we have done a lot of work, a lot of good discussions, a lot of good, brilliant legislations and policy. The challenge we have is about the translation and also implementing and giving appropriate attention in terms of resources. and log in with key indicators. And for specifically areas of welfare law or beginning as well as lookout and beginning as far as is concerned, and mechanics of the structures should be able to be in place in different levels to ensure that policy is effectively policed and implemented and achieve the desired outcome that is we wanted to achieve by having in place legislation or a regime like Lookout and Beginning Act. Like it was enforced or enacted in 2015 or thereabout. And in terms of socializing it and connecting up with the different partners and stakeholders to ensure that legislation is given its rightful programs. I think at the provincial level, Simbu, we had a structure. We had a restructure around 2018 thereabout, and they processed and they created positions to accommodate, try to see how we translate the legislation in terms of the structure and the capacity to get in develop programs. But we have not, the earlier administration have not fully implemented the restructure due to other intervening development like changes in the administration, political aid and so on and so. But we have not gone down to the level where we have a committee or so to establish to look at. Recently, we are revisiting the restructure, and as the governor has presented in the presentation, we have now broadened the areas that what we should look at. And one of the areas that we have now expanded is in the areas of community development. And we have expanded the office and also to accommodate all these shifting challenges. And in the areas of children and youth and women and all these marginalized issues, we're trying to give them prominence in our new restructure. And it'd be very good to have a country of strong conversation with the community development as well as the new creature that has been recently established.
Yeah. So PA, like,
we have not, what I'm trying to say is that there is some discussions like from time to time, but primarily driven by agendas, not necessarily by community development, but by development partners, because they have a lot of programs that, so through them we had discussions, but we have not gone around to establish a council or some form to address that issue of the child protection.
Yeah, but PA, since your appointment, and I'm not sure when you were appointed, but as the director, the current one was just appointed recently, but the past director of this Office of Child Welfare or Family Services, it's an office created under the Lookout and Beginning. All come brief him you too long the requirement of this law and the need for the provincial government in Simbu to set up the Provincial Child and Family Services Council or not?
No. I was appointed in 23 around May. I assume office, and
since that time up to
since
now,
then we have not had any consultation or.
Yeah.
But the other programs that managed by other development partners, they normally come and discuss around also on the requirement of all this, but not from the Department of Community Development or from the new creature that has been developed. I think also while I have the opportunity, some of this creation also requires a lot of bottlenecks.
Yes.
It's too bureaucratic to a level that in terms of operationalization is now affecting it. So very little is left to go and do effective programming.
Yeah.
We have a lot of structures sitting everywhere.
Yeah.
And in terms of accountability, trying to hold them who's going to report to who.
Yeah.
So you were asking the director yesterday and I was sitting over there and I was listening to it, that then they already have a program, they have already an issue in terms of implementing themselves, because you have a secretary and then you have a director, and then both of them have got executive powers in the sense that they are appointed through cabinet process.
Yeah.
So who's going to be accountable to who?
Yeah. It's a problem. But PA, and maybe you can tell us too, like, from what you see, should maybe you have a mechanism already that can do this work.
Yes.
This is what I'm trying to suggest. That maybe we don't need another council, or what do you think? Like, do you need another council to focus on children in Simbu province, or maybe you, in your restructure that you are doing now, you might cater for something that will do exactly what the council is intended for. Maybe you can give a perspective on that, because like the act create another institution, but it looks good on the act as far as the law, but when we come to the provinces, you have your own dynamics.
Yes.
So do you see like a creation of a council can work in your province, or it might complicate things, or what is your take on this? So we can also recommend to Parliament, like, okay, this act looks good, but in practice, it might not work. The provinces have their own structure, and we should facilitate their structure instead of creating another structure. I'm just trying to work out, will it work or not, as you see it?
I think to answer, or not necessarily answer, but to help to try to come up with some understanding as to whether that act can work in terms of a council. So when you look seriously into all other establishment around, well, I was making an earlier statement, when you make things too bureaucratic, sometimes it slows down the noble intention of trying to develop a program, and then you implement it and then resource it. So when you have a council, then you already putting up a roadblock already here, so the issues has to be addressed there. All we wanted to do in Simbu is to have we already have a division, community development division, and youth. So all other parties that concern in that divisions are already in that division. All they need to do is develop program that can address issues of child welfare, issues of youth, sports, religion, as well as sanitation. So the sanitation issue is also an issue that is also loosely sitting, because the function falls under Department of Health, and PHA is focusing on the curative part of it, and part of the health part of it, but they don't have the appropriate capacity to say, okay, we will build water supply. They don't have the system to identify. So who's going to then identify this place needs a clean water access? So we are trying to say that we are now, through that restructure, now we are putting officers so that they will then able to go and generate data. So you would see in that restructure, we have a division completely will be dedicated to just do data. So they will do and generate data. So then they will link up with the relevant divisions who will require the information. So they will then generate the data, so that then they will use the data in order for other divisions to then develop programs to say, or identify, this is where there's a need to develop this program. This place needs this kind of services. We have an elementary school here. We have an health center or so here, but there's no water supply. Who provides this data? Or who provides this information? It's missing, so we are trying to address all this holistically through a structure. So we must have a capacity to generate appropriate, relevant, real-time information so that it helps decision makers or whoever sitting at the level of planning. They must have those so that it is able to address. So getting back to whether or not we should have a
provincial council.
Provincial council, although I think it will be a waste of time to have a provincial council. We just need to just look at the public servants, just get them to do their job, develop the program, and then process it up to decision-making level like governor and at my level to say, okay, do the planning and allocate resources so that then we can implement this program. Then it cascades upward or downward, but then it addresses certain indicators that locked in
Alright.
MTDP or any other plans that we have.
Thank you, PA. I have to be conscious of time. We have Western Islands coming up, but we started about 15 minutes late, so I'm trying to allow you all another bit of 15 minutes. But I have two other questions, but I will, if our committee members have other questions to ask, I will allow them. I just want to say this in respect of this council, that the idea is a noble idea, that we will have a council or a mechanism at the national level, at the provincial level, dedicated to monitoring our work in respect of children, all the indicators. We are working and putting resources, time and effort to all the indicators or not. So it looks good on paper, but 10 years, you may not work in something. National Council is just starting now after 10 years, and nobody has gone to the provinces, even in the case of me as governor of our capital city. No, not somebody from the director of that office came to me and say, with the city manager and say, okay, this is the new act and the requirement. How are we going to make it happen in the capital city? So there's a big gap. So I think we will ask the question to all the other provincial government, but I think the idea is, can you accommodate a system or a office or capacity within your structure that is dedicated to monitoring these indicators for children, so we keep us account on basic issues like immunization, nutrition, education, health for children, violence, and so we are abreast, and we can start to, put time and effort into those indicators. So I think that's one comment I want to say, so you all can think about it. Maybe the office of the director will turn up in Kundiawa sometime soon after. Now we put them on the spot. So they might get you all to start, Governor, we'll give you until May next year or something. They might ask you this. So you have to start thinking about it. I think the other thing that I want to raise in this respect is that we have the PHA, which is a board, a structure that is there to focus on health. We have the Provincial Education Board. We have the Council of Women. Now it's undergoing revival. So I think we all need to have a look at all these mechanisms that are created by the specific act, and then comes to you, Governor. You're supposed to be the miracle guy who's going to make everything work. So I'm talking about you, but I'm thinking about myself too, and Governor Sasi is here. We are going to accommodate all this act, and then you are not given the money. So we have to think about this seriously. So whatever you all think, come up with, you all can submit to us, so we'll make a recommendation to Parliament. Maybe we need to amend this act, or we think about it in a different way, but the intention is that in your province you must have a capacity or institution or mechanism to monitor the indicators for children. I think that's the important message I want to convey. Committee members, you all have some question, or we have
just
to
one.
retire the governor and his team soon?
I think maybe the PA can answer. Yeah, I think child abuse is a problem everywhere, and I think Chimbu is not immune from. Just a quick one for the PA. Under the restructure, do you have any positions in the nature of child protection officers or some such similar positions that I think it's a requirement under the Lookout and Picking Act for child protection officers for all the provinces. Not necessarily child protection officers, but some other similar positions in the restructure that's pending, I think, to be formalized shortly, I think.
I think Governor gave a bit of indication on this. The act says that Governor, you must appoint and train and have child protection officers. That's a requirement of the law now. So, director has not told you, but now we are telling you, and the PA now.
I think part of my presentation, I just mentioned that we've got a officer taking charge of this. And I think with the restructure, I think we are looking at, I think, one in each district, so something like that. Yeah.
Thank you, Chairman. I think I have only one question that's regarding the role of the PHA. So, as before I asked the question, going back to the council, we are talking about the council. So, I'm not sure. 10 years the council hasn't worked since the law was passed. So, I'm not sure how it will work in the provinces and in the districts. So, one good issues that the chairman has highlighted about the council. So, we'll see how the department and what's this?
Office of Child Welfare.
Yeah, the Office of Child Welfare can respond to this. But my particular question is regards to yesterday, the health secretary alluded that since the establishment of PHA, there has been a disconnection and they don't have oversight over the PHAs, and PHAs they don't report to the health secretary or the health department. So, my question to the CEO and the PA is that really true that the National Health Department doesn't have any oversight? The word that the secretary used was it's an organ of the provincial government, which means the provincial government, they are responsible. Provincial government is responsible for this, and they only report to the provincial government, so they don't have any say over this organization, the PHA. So, is that really true that you don't respond to, you don't report to the National Health Department? I believe who has the oversight of any health issues in the country. So, since those things, the issues about health, when we raise about especially our children about immunization and polio vaccination, all those things, they just they throw everything down and then they don't oversight those whatever that is implemented at the provincial level and then also at the district level. So I would like to know, do they have the oversight, or do you work, or do you report to them, or no? Thank you.
Thank you, Chairman, and through you, a very good question given by panel member, honorable member for Mineva. It comes down to the delineation of our roles at the national level and sub-national level, provincial, and down to the districts, and the parties that are in play of making something work. The policy that we want to implement we are implementing in the health sector is the National Health Plan 2021 to 2030. What role the national agency and health department plays, supported by the central agencies of national planning and treasury and finance, and then down to the provincial level. That's where we are, our good governor and provincial administrator, and with the PHA established out from the organic law or the local level government. The policies are clear. That's for all of us to implement, and also acknowledging the development partners too. They come into play in this. In terms of reporting, there is a mechanism where we report every year on the indicators. There are 206 indicators in health. We report every year, and the report is always given at the end of the reporting period. And our good chairman was mentioning about some of the data, and I was nodding my head because we got our 2024 report last week, sector performance annual review last week, and it will give provincial indicators and down to the district indicators too, all the health indicators on the 206. summarized in about 28 in the SPA reporting. That's the reporting mechanism. But in terms of the agency reporting to the central agency, that's where a lot of the PHA over the years have failed. It's not that it's not in there, it's a prerogative of all agency head to report to the central agency. For us, we are on time in our reporting. There's the copy of our third quarter report. The PHA Act, Amendment Act 2023, stipulates that quarterly reports must be given back to the health minister, to the governor, because they signed the PHA, and they are the fathers of PHA, and we must also give to the secretary. It's just clear in the Act. So if we fail to do that, then I think it's the prerogative of the central agency health secretary to come down hard on the CEOs. Ours this is the third quarter report was signed on the 2nd of October, and we presented to the central agencies, including the office of the health secretary himself too. So all the other agencies must do the same. PHA. It's just there. We are failing our own health system and our own people if we are not doing this.
All right. Committee members, I think for want of time, I have to bring our dialogue and engagement with our team from Simbu, led by the governor, to a close soon. I think, yes, I'll give you time to say some final words, but I'll just have an indication. Is the team from Western Islands here, or if the team from Western Islands is not here, maybe we can continue a bit. I have about 3 other questions, but I'm just pressed by time. So maybe, Governor, you can have some words like closing remarks.
Yeah.
Yeah.
Okay, thank you.
I think our member for Wawaria has a question too.
Before you do the closing remark, I have questions to ask, especially to the provincial administrator. You have a 5 or 10 year provincial development plan.
Yes.
You have okay. So, what do you think about this? I'm again to wash again. So we have the project management unit from national planning, and they are doing sectoral plan, WASH sectoral plan for the DDAs. Do you think it's a good idea for province to have a WASH sectoral plan at the provincial level, or you think just a 5-year development plan is sufficient for the province instead of coming up with sectoral plans? Just because with your experience.
Thank you. WAS is a new program, and start to take it safe, and much of it is under discussion, and try to detail as to how the program would look like. I think last Monday, last meeting was held for Islands region was held in Mount Hagen, and our team were there, our planning team as well as I think PHA, everyone was there, discussing through to see how effectively we can able to develop a program to then connect down to the facility level or the district level to where this can be implemented. But coming back to your question, like say whether we should have a sectoral plan, going back to my earlier statement around when you create a lot of structures and reporting templates, then sometimes it delays things. What we have, the structure as it is, it's okay. All we need to do is to, because our integrated development plan is now vetted by national planning, which starting there in charge of the WAS program. Because every province has now been asked to amend or redo their integrated development plan given in light of the new, MTDP4 launch was last year. So everybody was asked to now realign into the 12 or so strategic area, focus area. So then you develop specific programs as to how they can then link up to address the strategic directions that identified in the MTDP. So WASH is also an integral part of to addressing as far in the areas that sanitation, access to clean water, uninterrupted water supply system, so on so. So even program level is, I think it should be sufficient, and even another layer of sectoral planning, because then the reporting becomes very easy when everybody is asked to just, because we will be at the provincial at the implementation level, we will be guided to develop action plan. We have an integrated plan which is aligning to the MTTB priorities. Then each division will be then doing the action plan. Then give our cost to it, so then it helps us to in our budgetary process. But unfortunately, we have not been receiving much of the funding, so how do you expect us to implement any program when we costed it there?
Yes, that leads me to another question. I think I wanna thank you for your response. Like it's we just like the Child Welfare Council. We at the national agency we are creating different programs or different entities, and we want to solve it down the province and LLGs to implement those one. But it's not working because we are limited by resources at the provincial and LLG levels. We are limited by resources. So this is an example of child welfare. Is an example of a national agency. We created some agency at the national level and we shove it down the province to have it. But we don't build the capacity of the province to take on board this one. Another example is the WASH. Yesterday they came to discuss about the National WASH Authority. They will transform the project management unit to a separate authority. So we are creating another authority, another entity again. And then, so that's why I'm asking about the WASH plan, because the authority will want you to do a WASH plan in order to get the funding for yourself, for a province. They will be looking after those funding, and if you want to get this funding, then you have to do the WASH plan and all these things. But you already have a provincial development plan or district development. And so this misalignment from the national agency to the to provincial government and to the LLG and DDS we need to correct that misalignment. So anyway, but in this situation, Governor and PA, all through my inquiries, I'm a chairman of the communication committee, and we conduct inquiries also. One of the issues that the agency are facing is they are not receiving their functional grant. And now I'm sitting in this committee and I'm hearing the same thing. Agency are not receiving their functional grant. So how can you put public servants on payroll, but how can those public servants do work if they don't have funding to buy fuel and buy a car and accommodation, balance ticket and allowance to go and do those stuff? Yeah. So we are just paying them, but they're not doing anything because they don't have the functional grant to do anything. So that's the issue we're having at not your province only, but in Morobe and all the other everywhere. So Governor, can we bring the treasurer or the secretary for treasurer in so they could explain why the provinces are not receiving the functional grant? Okay, can we do that? Because this across my committee is facing the same issue, receiving the same information, and now this committee is receiving the same information. So we need to dig down and find out. We can conduct good inquiries and go in this, but all bakam to no got money lo work here. You blow but me blow no got money lo work here. Me blow give report lo paper. So we need to bring the treasurer. You summon the treasurer, the secretary for those respective departments, finance planning and treasury. The secretaries, and they come and tell us. Give us a status of each province. How many percentage of grants? We are in the third quarter now. How many? Talk straight. Country no got money or got money? You mean it lo talk straight, huh? So this is chairman through you. I'm another chairman too. So you.
Yep. So committee member,
that's a question to the chair.
Yeah, it's a very valid, pertinent question. Governor will give his take, but for our committee, those respective departments have been asked to come. Yesterday we were supposed to have a treasury and finance to come. So what I'll do now is I'll send, for now we can't subpoena them yet, but maybe next inquiry we'll subpoena them. We can have an inquiry just to subpoena them to come and tell everybody why the functional grants are not going to the provinces. So we can probably have like 1 day session during the parliament session. But the public needs to know, governor needs to know.
Yeah.
Governor Western Britain too on our committee needs to know. Will the functional grant for the entire year and outstanding for last year be delivered or not? How is the province going to perform and deliver the outcomes that the people expect, or they've sent their plans and priorities? So this is a core issue that goes to all the outcomes, both in terms of our committee, your committee, and their own, corporate plan and deliverables. So what I'll do now is I'm just sending a message to the two secretary for Treasury and Finance to see if they can come in, and we'll just ask them that one question. For now, just ask them the one question: when will the functional grants be honored? So if Western Islands is here, we can bring Simbu to an end, but otherwise we complete our question with the governor and the team from Simbu, and then we'll see how we go from now on. Yeah. Yes.
Yes.
One, just to help governor, I'm not talking about provincial government functional grant. That's totally a different thing. Of course, previously the health used to be under provincial government. We used to have a provincial health advisor, and the provincial hospital was called as general hospital, and it was looked after directly by Department of Health. I was just receiving, of course, this message had I received yesterday, then I would have asked this health secretary and all, because including the minister and secretary, they always claim that PHAs are paid on time, but then I just received a message from our PHA, West New Britain PHA. The total appropriation for 2025 goods and services is 17,846,500, 17.8 million. But the amount received was 8.4 million, 47%. And the money was given on a monthly allocations, and money was received only up to June. And that too, there was no goods and services, only PE. PE means personal emoluments, I think. And then this is 7 out of 17.8, 8 million cent, only 47%. And this is health we are talking about. The other sectors are okay. If they are not received, nobody is going to die. Okay, in here, the health function grant appropriation, health function grant, which is the most important one for them to, like just now Honorable Mosh was mentioning. The total appropriation is 6.5 million, 6,528,800, received so far 1,326,701 kina. That is 20%. You're talking about the operational expenses. For the whole year, it is only 6.5 million, and out of which only 1.3 million received. And the goods and services, out of 18.8 million, 17.8 million, only 8 million received. Yeah, and there was no payment after July, August, September. But every time we raise this question, they always say, no, money was paid. But this is the fact, with full information of what exactly they received on monthly and where they allocated and all those things. This is how they, corner or yesterday, Chairman, that somebody from planning department, I think Mr. Tanda, he said it very clearly. The government only allows where their priority is. So the money goes to their priority. Maybe this is not the priority. PHAs, this is why it's a very dangerous, situation where you think that the province will look after, and the province think that you look after, and nobody looks after this organization. And this is terribly affecting the service. Especially health delivery in the province. And of course, everybody is expected. Always they say. Yesterday they mentioned because we do not have vehicle, and that's why we could not, achieve immunization rate. The health department, have various divisions and all those things. And if you want to allocate, we every year in and out, we keep buying ambulances, but yet, it's not enough. So I think there is a total communication gap. The health department want to paint a picture. Everything is rosy. Everything is good. everything is running like the whole. I think God has a big heart for Papua New Guinea. Somehow God's mercy, we all survive. I do not know how the baby born on the beach, but it's born almost every day, delivered, and we have survived without even complications. I can't imagine this happens in other country, but here it's like our people have so much of blessings and stamina, where without any basic service they can still deliver babies and they still survive. And those who cannot afford to, we cannot afford to bring them by chopper during complications, they die. So I think, Chairman, with your concurrence, that as you rightly mentioned, that this treasury need to be asked. Okay, you want to starve other functions. Okay, you starve it, but why would you starve health, where it risks people's life? Of course, this also, for example, the functional grant for the province for the whole year, it's 45 million kina, and so far they would have sent less than 17 million or something, which is like 40% or below. And how does the province, function? It's called functional grant because without that you can't function. That's why it's called functional grant, like health functional grant. Out of 6.5, only 1.3 come. So it's all the same, Chairman. Thank you.
All right, committee member and governor, now you are a committee member, so you have the power to make a recommendation to Parliament on this particular aspect. So, but now we give the opportunity to Governor Honorable Noah Cole to make some closing remarks. As I said, I have 2 questions, but maybe we will leave it for now or something.
Yeah.
Governor, you
Okay.
make some remarks.
Thank you, Chairman. I just got around 2 points to clarify before I close our session. For the functional grant for the provinces, we are not receiving it. The last time we received was, for last year was 40%, and this year it's just going towards 30%. So I don't know how we are going to implement all the plans and programs that we have planned for this year. So it's good to bring in the 2 secretaries and grill them and find out what is really happening. So they must come clear and tell us, so we can be conscious of all these things. Yeah, be honest and tell us what is the status of our finance in the country. So we must be clear on that. For my province, it's a disadvantaged province. I received only 1 million per month, 1,100,000 per month. So how can I, find the money from to deliver for the people, my planned projects? It's very, very difficult. It's very, very hard. But I'm struggling, just like Governor for West Republic was saying. We are living on God's blessings, you see. That's what is happening in my province. Okay, for number 2 is the youth plans for the country. Through you, Mr. Chairman, we can try it out in Simbu. If they want to try it out, we can try it out in Simbu and see whether it's good for the country or not. We are ready to try it out.
Okay.
So
Yeah.
this is a request we are putting forward. If they want to try it out, they can come to Simbu and meet us, and then we can have a round table discussion, and then we can try to see what we can do. These plans. If we can have our own committee up there, we can organize the committee, and we'll see. I think we are organized. I think we can do something along this line. And for the reports, I think it's good. Through you, Mr. Chairman. All the reports from PHA and all the reports from other organizations must come in on time. My CEO here and my administrator, their reports are always on time. I signed these plans and programs, these reports. So they're always on time. And I value what they are doing in the province too. And someone has got to be taken into account why they are not reporting, taken to task, why they are not reporting on time. Because report is very, very important. Yeah. So it tells you about the indicators and are you achieving some things or not? If you're not achieving, they need to take the next step. So at the end of the day, we must achieve results. And lastly, I want to thank you for giving us the opportunity to come and face the Special Parliamentary Committee on Children and Youth. We're happy. We must be in dialogue. We must be in consultation. We believe in that because it's talking about the development of this country. It's not a small inquiry, it's a big inquiry. And I think it's the best of its kind, and we value that. That is why you see, I have to bring my CEO, I have to bring my administrator. We value this committee's session. That is why we think for us to come, we must give prominence to the committee. And what little presentation we made, we are happy. And I'm glad that the donor agencies reps are all here. Some of them are here, and they've listened to us, and I think we can dialogue with them later and try to do something for our province. So with this, I say thank you very much for this initiative. We are behind you. Continue to. And I don't know whether we have teeth or not. You've got to exercise your powers and you've got to grow the teeth now so that you can bite. We want you to bite. Thank you very much.
All right, thank you. On behalf of the committee, I want to thank you sincerely, Governor, and your team, PA, CEO of Simbu PHA. Thank you for respecting our committee and coming to deliver a very comprehensive presentation. We appreciate the effort and time you have put into really address some of the core issues that our committee has oversight over, or it's in our terms of reference. But we also acknowledge the other areas you have addressed as well. I think among other things, the pertinent issue is about funding. So for the purpose of our committee, but also for the important work that you have to do for the province of Simbu and for that matter all the other provinces too, we need to have some clarity on the funding situation. It has the multiplier effect on all the sectors: health, education, infrastructure, youth, women, church. It all comes to that bottom line. So I've sent a message to the two secretaries, Treasury and Finance, to see if they can appear. And if time does not allow us, we'll ask them only those two questions. I mean that one question. How are we going to honor the commitments in the national budget for functional grant this year? If not, what is the problem? And what about last year? All the outstanding functional grant. How are we going to fix that now? My understanding, I think it's not for me to say, but I think there might be a supplementary budget in the forthcoming parliament session. So maybe that will give us some clarity if the committee and the two secretaries does not appear. But let's hold the national government to account in that respect. And hopefully the two secretaries will tell us. Otherwise, I want to commend you all again, and it's for us. It's just a start. We will read your report, and then we will come to some particulars. We might call you all again to appear, or we will send you some questionnaires again. So, like for example. For our committee, I think the two questions that I want to raise with you are in question 2 and 3 to get us to be more clear about what you all are doing, especially in those two specific areas. So I think question 2 relates to immunization. What you given Governor, you given a general sort of outline on the efforts on immunization, but what we need from you all is that what a specific effort you all doing to ramp it up, because the Secretary for Health mentioned that the target should be 90%. 95 or something percent up. If we can reach that, then we are really providing immunity or protecting our children. Because if we are below that, the chance of the virus, reoccurring, or there is an outbreak, like now we have polio. Polio virus has made a return after 25 years. We eliminated it in 2020, but now it's made a return. But there's no outbreak yet because maybe the first phase has enabled us to have some level of immunity. But now there is a second phase, which will back it up, and we need the provinces to target 97%. 95 or 97? 95%. So that's one area we want to know what action you are doing to really ramp it up in your province, our province of Simbu. I think the second one I wanted you all to maybe write to us later is about the stunning rate. With stunning rate exceeding 60% in the provinces, what programs are you all scaling up to address child malnutrition and stunning? I think that you address Governor generally on the nutrition, but what that question trying to elicit from you all is that how are you ramping it up to improve nutrition at the community level in Kamantap? There must be some very clear strategy. We are going out doing awareness, or introducing some sort of a PHA or education, or down to the lowest level, so that the parents are really taking it seriously about the nutrition of our children. Because Governor, you play rugby, and I'll pick play now. I'm not sure about play rugby because stunning is affecting them. So nutrition contributes to both physical development and mental development. So if the nutrition is not good, it stuns their physical growth, so all come up pygmy, so they can replace you as halfback kumul or something or something, or come up forward or something or something. It's a problem, and we all want to beat the kangaroos, but now we worry that maybe in my lifetime we cannot beat the kangaroos. Just giving us an example, because of stunning. And of course, in the intellectual capacity, if we continue to have poor nutrition, then their mental development is poor. So how will they become smarter and wiser as per our 2050 vision, taking their life to another level, or meeting the digital artificial intelligence age? They might be left behind. So this slogan that the United Nations is promoting and government is embracing, no one left behind here. Mentally, they might be left behind. Everybody else, the Chinese are going, very Chinese speed into artificial intelligence and digital age, conquering everything, using it to enhance all the aspects of their development. But will our children be able to understand it or embrace it, or harness this new technology and understand the economics of it? So it comes back to this basic. This is why this committee's work is very important. We're trying to build infrastructure now, building, kind building in Goikam now, deliver health and education, but if we don't get this basic right, we will still fail. That's the key message of our committee. So thank you for the dialogue. Those two issues, we'll read your report, and if they are still outstanding, clear, we'll write to the PA or to yourself. Governor, thank you for your time. You've exceeded your time that we have allocated, so I want to thank you all sincerely on behalf of our committee. PA, CEO, thank you.
Thank you. Thank you.
We have Western Islands here or not? Any other province? In a province supposed to be here. Their governor messaged me to say he can't come, but his team will be here. Or shall we have a break a bit? All right, let's have a tea break. I think maybe there's some tea here. Everybody in attendance here at the state function room with the committee members, we can have some tea and see how we go from here. maybe the two secretary will create some miracle and turn up. But if they don't turn up, and you plus committee members, we have the power to summon them. So I'm happy to summon them if we do a special committee meeting, maybe during or within the session of Parliament. All right, our meeting is suspended for a while. Oh, Governor Vice President.
Give it to the committee.
I'm using my discretion to call the NGOs who are here. They've been attending since yesterday to be part of this conversation and inquiry. They're doing a lot of work, and they also deserve to be part of the inquiry. They've not been summoned or invited, but they are important stakeholders. We have a children's fund and Save the Children's Fund and Child Fund here. Okay, you bring them back now.
Oh, yeah. Okay. Mm. Sorry.
Our two governors, I have to interrupt your deep conversation. Yes, we will resume. Thank you, committee members, ladies and gentlemen, our development partners, media. We have a situation where the provincial government who are supposed to be here by invitation are not here, but we still have some time before lunch. I have the information. Yes. All right. Committee member and Governor of West New Britain, later on maybe you can voluntarily submit the report from West New Britain, but I want us to take advantage of this time and opportunity to give our NGOs opportunity to have their take and contribute to the the inquiry. So before us we have Ms. Pamela Krisimpa. She works, I believe, with Child Fund. And Shelley Kaupa, she has an NGO of her own working in the space of GVV, but also around children's protection. She's done a lot with juvenile work, supporting juvenile. We might have Save the Children Fund representative coming in later on, so using my discretion as chairman, I've invited them to contribute to this inquiry. So, Ms. Krisimpa, you will have the floor.
Thank you, Chairman of the Special Committee and our Governor for NCD. So I am from Child Fund. My role is I am the Program Manager for Gender and Protection. Child Fund has been in PNG for the last 30 years and mainly working in Central Province for the last 30 years, but now we actually scaled up to Arab, Sundown Province, Oro, Million Bay, East New Britain, Morobe, and eventually we're going into the Highlands provinces. Our vision is a world without poverty, where all children are able to say, I am safe. That's where our child protection program comes in. I am educated, I can contribute, and I have a future, where our health program comes. So we have programs from education, health, disaster readiness or risk reduction, social and emotional learning, because we also believe that children need to be empowered so they have a voice and they can speak up around their rights. And under gender and protection, we integrate that across all our programs, but I oversee the One Talk Counseling Help Him line, It's the only national helpline in Papua New Guinea and a very successful one in the South Pacific. We operate 24/7 survivor-centered telephone counseling services, and we have a toll-free number. So if you have a digital phone, you can call 71508000, and we provide support to women and children who are in need of protection. So we mostly provide crisis management where when they call, so that same number, we have 14 lines open at the same time. So that means 24/7, meaning our telephone counselors are working from 7 a.m. to 3 p.m. shift, and then 3 p.m. to 11 p.m. shift, and then we have the graveyard team coming on from 11 p.m. to 7 a.m. every day. It's a 24/7 counseling service, and we're so thankful to the government of New Zealand for funding that program, that service in the last 10 years. We are slowly transitioning that program out from Child Fund, hoping that it becomes a Papua New Guinea own. So we currently in the transition phase. We are looking at options where whether we house it under National Office of Child and Family Services, or a local NGO wants to take it up, or we go down the road of registration to have it like a separate entity. So we are also affiliated to that program. One Talk Counseling is affiliated to Child Helpline International, that supports providing support to children who are in need of protection. So yeah, we're going down the road to strengthen services for survivors of GBV and children. That's why we're working very closely with NOCFS, and we are so thankful that they now have a director in place, because that's one of our greatest challenges. But we are also part of like our other partners, we are part of the child protection subsector and GBV subsector committee, which UNFPA, UNICEF, and others are providing the secretariat to. Yeah. So that's, yeah. Some statistics that I wanted to share. So since the establishment, and I will talk mainly around the One Talk Counseling Helping Line, since our establishment from 2015 up until now, we've received over 87,000 phone calls throughout the 22 provinces in PNG. We have statistics, and we can give that to all the governors, all the district MPs, of how many callers call in from your district or from your province. 61% came from NCD. The reason doesn't mean that because NCD has a higher, rate, against children or women. We believe that accessibility is another issue, and also people not knowing about One Talk counseling. So in regard to that, we are improving on our visibility. That's where we want to partner with the provincial governments and the district governments, so that we can have our number put up in the public places, the toll-free number, where anyone who sees the number and has a phone can make that free phone call to One Talk Counseling Helping Line. And so when they call, we don't call them victims, but we call them survivors. When they call the One Talk Counseling Helping Line, crisis management means we help them to come up with developing a safety plan. So whatever we do not want to re-traumatize the person calling or put them in further harm. So we come up, and it's more survivor-centered, so we listen to what they want to tell us, how we can help them. And because we have a service provider directory that we update every 6 months, we have contacts of every safe house, every police station, every health facility, family support center across the 22 provinces, and we can refer them. Sometimes people just call us. So the calls that comes in are not only from the survivors, we have perpetrators who call the number as well. We have witnesses who call, Sometimes they see someone being abused or someone needs help and they cannot call, they call in. Often perpetrators, they grab the phone away from whoever was calling, and they want to know who that number, who is from on the other side of the line. Yes, so I wanted to share some statistics for September. That's just last month on some of the cases that we received. So for September alone, and on a daily basis, we receive on approximate up to 150 phone calls per day. We received a total of 1,182 cases, and 452 were valid cases. We've done 101 referrals, so we work very closely. So in terms of referral, because we cannot provide a full case management. Case management, you know, is where someone is working with the survivor until they get the help they deserve. So we refer to our partners. NCDC Gewe unit is up. We have an agreement with them, which we will sign soon. We refer to Family PNG, Belize, and our partners like Magna Kanta and others. Like, we work very closely with Cybercrime Unit. We also have a MOU with them, and I am not proud to say, since February this year, we've received on average weekly 10 cases of online harm. Technology facilitated GBV is on the rise, so this is an area that, you know, we want to support and we need to look around. We currently have a partnership with Save the Children on enhancing digital safety in the Pacific, in both Solomon Islands and PNG, and we hope that this, you know, can strengthen our work. We have a agreement with the Department of Education, Health. We are also rolling out immunization in Central Province. With the Department of Education, our team are working with them on the SLEEP program. They're working with, you know, strengthening the governance of the team, the schools, and that's mainly in Arab and Sundown provinces. So a lot of things are going on. Our head office is at Gordon's. For one-talk counseling, it's at a secluded location. I can't give the location now because of our safety as staff and the work that we do. Yes, so I just wanted to maybe finish with, you know, informing the public that in the event, and we have a lot of online harm going on, especially our young girls. We've had stories that they've committed suicide because nobody believed them. AI, with the introduction of AI, they're able to extract their face and put it on someone else's body. We get this type of calls every week. And so I wanted to say if any of them have a situation like that, you must know that help is available. There's someone who is here to help you. Call One Talk Counseling Help Him line on toll-free number 7150-800-8000, and someone will assist you with that. Also, we've recently approached Office of Censorship, and we are about to sign a MOU with them so we can work in that space with filtering the contents that go out. Yes, so this is some of the work that we do.
Thank you, Ms. Krishnpa. I think perhaps you can just explain to the committee, like this child fund, where do you all get your funding from, and what is your funding capacity, and have you all solicit funding from government and donor partners or development partners? Perhaps you can give us that background. And then I can see your work is mainly in the area of violence against children, GBV of course, but for our committee, violence against children and child abuse. Maybe you can comment on that in terms of giving us some idea the extent of child abuse or violence against children. There is statistics that I've read out today from UNICEF providing us, but you know, the practical experience that you all have, you can give us that impression, because while we have focused on gender-based violence, there's no spotlight too much on violence against children, and the work of this committee is to also focus on that sector as well, and lift it to the public domain so that we can start getting action to keep down on child abuse, including like neglect, child neglect. Parents may be too busy or they have separated, and there's a problem with where do the children go? They go with the mother or father, or they are lost in between. Or, so if you can give us, from your experience, the perspective on that, we will, have it recorded and be part of our work.
Okay,
And reporting to Parliament, of course. Yeah.
Thank you. Part of our plan at Child Fund through Wanto Counseling is we are also exploring the avenue of having web-based reporting, because nowadays not all the children want to speak with a telephone counselor. So a study that we were part of, we discovered that. So we also were involved in the international consultation on child helpline in Zambia this year. Thank you, UNICEF and others who supported our travel there. And one of the things that we found out and we came back was children nowadays, they want to use web-based reporting. There are so many children who are being violated, through sometimes, like, maybe I'll go back to what you mentioned about children, parents who separated and the children are affected. Of course, the children will be affected. So we always try to support the parents to see how best they can reduce and minimize. Sometimes the parents will have a reason to why they will be separated in the event that, their life is at risk and they made those choices, but children are never consulted, and they are the ones who, who go through all these psychosocial problems. And when they cannot speak with someone, that's where the importance of counseling services is much needed here in Papua New Guinea, where, we have counselors who can provide not just psychosocial support, but mental support for children who need that support. And so a lot of times parents are making decisions without considering the views of the child. And I think the view of the child is a paramount in the child rights, one of the pillars where we need to also consider how they will feel and understanding how children think and feel. Many of our parents do not understand that. But we are also grateful that, UNICEF and all our other partners have this positive parenting going on in the communities to help parents to understand the importance of knowing how the child thinks and feel at different ages. And child abuse it's a disease. It's on the rise. It's happening every day. It's happening. It's been done by people that the child knows. So we encourage, children to speak up. And there are organizations doing awareness on kids, kids safety, about empowering children to speak up, because a lot of time the children are abused by known people. It could be the extended relative living with them in the house. And a characteristic of a child, a perpetrator at home would be, they might be very playful with the child, and you will never know, but we want to have, ask parents to find time to talk with your children. Maybe at the dinner table, maybe during lunchtime. How are you? What's happening? Did anyone, you don't need to use explicit languages on children who are very young. We have programs that we can raise awareness around how to protect themselves, what is child abuse with the small children themselves, like good touches and bad touches. For instance, we will speak with the 5-year-olds and 4-year-olds. Okay, no one's allowed to touch your hair. No one's allowed to wipe your, touch these. No one's allowed. So, you have children coming and say, oh, he touched me here, he touched me there. It starts from there. And then as they grow up, then, some more in-depth awareness around how to protect themselves. So I cannot say our country is safe for our children nowadays. It's very unsafe, And we need the parents to be extra protective. And if they're separated, some sort of arrangement, if they're co-parenting, they should understand what co-parenting means. You should never be, angry that your wife will allow you to take the children over the weekend, your ex-wife. And then, the co-parenting concept, it's still not understood in Papua New Guinea. But in some countries, it worked very well, and that's how the children are protected, the co-parenting. So the children stays with one parent for a certain number of days, maybe during the week, and then they're allowed to go with the other parent the next year. So there are so many issues that are affecting children. And another thing, because I mentioned earlier, we are working with censorship. We're also talking with NICTA. How can they have some control? Because we already are working in that space under the Meta project, where we get supported from Child Fund New Zealand, who has a net safe, where they also have a direct partnership with Meta. Meta owns Facebook and WhatsApp and TikTok. So we're working on the Take It Down website as well, and the stop non-conscious uploading of images, where if you have images, so we can share those those two websites with the committee, and then you can have it as part of your report back to share. I don't think I answered.
Yeah, you have not answered my question about your capacity, where you get funding from.
Okay.
Whether you get funding from the national government or other, state agency. Maybe you can answer that question and also comment on the effort of the this council, not this council, but the Office of the Child and Family Services. Is this office, since it was created in 2015 after the passing of the Lookout in Piginini Act, are they robust, or are they reaching out to all the communities around the country, or are they working with you all NGOs, or what is the extent of their services? Because we heard from yesterday, 10 years and they couldn't put the council together. And now the governor for Simbu has testified before our committee that they have not gone to Kundiawa to even brief the PA or any team about the requirement of the Lookout in Piginini Act. So we've lost 10 years, and the problem with this 10 years gap is that it might be okay for the incumbent sitting in the office, but our children are the victims. 10 years of inaction is a serious consequence, some of which you are highlighting now. So please enlighten the committee so that we know what different stakeholders, especially in civil society or NGOs, are doing and their funding capacity. And secondly, your impression of government services, because for us as government, we cannot outsource the responsibility of government. The government must be in the front line providing the basic services, and where there is gap, then where you all NGOs come in or the church come in. But to a lot of extent now, it seems like government is either by neglect or by simply inaction. We are outsourcing responsibilities that are you all NGOs coming in, trying to do, but you don't have the capacity to. So it has to come back to the government. The government has to be brought to account. So
Yes.
maybe you can comment on that, and we can have open it up to the council members, committee members, and then Ms. Kaupa might also have a take too.
Yes.
Yeah.
Thank you, Chair. Yes, so just before I go on to that, I just wanted to maybe explain a bit that our government needs to know that the INGOs, some of the donors will not always be here. They will not, they will not be here all the time. So how do we capture some of the activities and have them aligned to our national budget? And one of those is the helpline that we operate right now for 24/7. It's the only effective helpline in the South Pacific. So I mentioned earlier that it's transitioning from child fund. We are so thankful to the New Zealand government, the people of New Zealand. They've supported in the last 10 years since the establishment. And on an annual, the budget for operating the helpline is $3 million. $3 million per year. And I just thank you for this opportunity because we have a MOU with Office of Office of Child and Family Services. The challenge was, during the past year, the office was, we lost the director, the CEO, and then the office was kind of not functioning. Even though they tried to support with the few number of staff they have, but they were not. And we find one of the challenges, we find a disconnect between the National Office of Child and Family Services and the local community development in the provinces. And it's a challenge because they have a structure in place in the provinces as well for child protection officers, but it's not funded or it's not been taken up yet. Yeah, their reasons are known to them. And so, so that's some of the challenges. We also reached out to NOCFS to support them with the street children when they did the hotline. So after they launched, we took them to see our setup with the call center. We have a PABX system that operates, so there's a big screen like the New Guinea where you see the flights coming in. We have a PABX system where we can see the calls coming in, number of calls answered, how many staff are working at the time, how many calls come in, and so forth. So it's a big need for us in PNG, and it's the only helpline in the country at the moment. So maybe we have what's the other one?
That's the police toll free.
Yeah, okay, yes.
In your experience, this Office of the Child and Family Services also work on the program, or do they ever reach out, or they run family this services like this line counseling? Sorry, I'll repeat that again. Perhaps what I want to say is that this office, for us, we are members of parliament and the committee of parliament, and we have to make the government work. We appreciate the work of the NGO, but it's the principal responsibility of government to provide service to the people. And government cannot outsource its responsibility and function unless it enters into an agreement with specific service providers. Otherwise, it's the principal responsibility of government to provide services, including counseling services or all the support services or child protection services. Or it's the responsibility of government. So what I'm trying to elicit from you is that we had this presentation from the secretary and the director yesterday, but we were questioning them more about why the council has not been set up. But in like reality, since 2015, he coming up now. This office are working some work, or he got some program, or he got some of this hotline, or they have been setting up the all these child protection officers. So what is your take on this, so that we all can report to Parliament that this initiative is working or it's not working, or maybe we'll come up with another system or things like that. If it's working, then we will make a recommendation and report to Parliament. If it's not working, then we need to report to Parliament that maybe this system is not working. We might have to come up with a new mechanism that can do the intervention quickly, so we support our children. That's like on behalf of the committee, what I'm trying to elicit from you also.
Okay.
Not to badmouth the office unnecessarily, but to tell the truth and work on that.
Okay, thank you, Chairman. I am so thankful that now they have appointed a director in place. I think that was one of the reasons why we endured all those challenges. Also, I want to say that
Yeah, but
the system.
Ms. Christopher, it took 10 years. 10 years. So
Yes.
we can be, thankful that we have appointed now, but we cannot accept the 10 years of inaction.
Yes.
For us, our committee, we not accepting this 10 years of inaction.
Thank you. The system is done in a way that it will support the children. We needed to have that office. I cannot see any other second option for that. We need the Office of Child and Family Services there to function. For us now, seeing this it's the people that are supposed to make the system work. So because of the human resource being available, we need some collaboration, partnership, reaching out. Papua New Guinea is not Port Moresby.
Correct.
Yes, but this office is what I want to know. For the committee needs to know is, have they been performing or not? And maybe I can extend it further by saying that, what do you see should be their role? They give you fund and you perform something, or what will be their role? They will be a regulating authority, or they will be designing program and implementing it, or this is a recommendation that we will be making to Parliament. We have to make an observation over this office, which is a critical office that the Parliament has approved to put in place to start to monitor the indicators of children that I have outlined today on behalf of our committee. And they failed to perform in 10 years.
Yes.
So you have been working, you and your NGOs have been working selflessly with the support of donor partners, but key government agencies that's supposed to be doing this work is not functioning. So that's why I'm trying to get from you. What is your take?
Okay, so I'll just speak.
You are saying that it's a relevant office.
Yes.
Okay, but what would be their role if it's a relevant office?
Okay.
And
Okay.
maybe you can go further by this council here. I'm good luck by you working or council by waste of time, or is there a relevancy of council? Something like that. Maybe you are not prepared to answer that. You could just give a response in that respect, but it's an
Okay.
opportunity for you
Yeah, that's
to
okay.
give your take. Yeah.
Thank you. So this office is supposed to support us in terms of funding as well. We cannot continue to rely on the donors. They need to map out and scope out who's doing what, as long as it's to do with children, protecting children and family. They need to do proper, map out the existing stakeholders on the ground, and there should be some budget alignment to what we are doing, because this is what we are doing is basically what they will be doing, and we are only supporting. And like I said, the donors will not be there for a long time. They will have different development priorities, and they can, depending on who comes into which country. Like, I'm so thankful to the New Zealand government in the last 10 years, but they also want us to transition, meaning that they might have, refocus. So Office of Child and Family Services need to have enough money that will support all these other existing services that we provide to support children and youth in this country. And I still believe that we should have the National Council of, and it's under the Act itself. The Act also mentions the provincial and the district, so this is nothing that we can change, but we should. And what they must now do is hold those regional consultations. And I'm thankful to UNICEF for working very closely with them. In fact, they are also with UNICEF on the child protection subcluster, co-chairing that. And so, the other donors in our small capacity, not donors only, but other CSO, in our small capacity, we are just implementing what the department's supposed to implement, so they can do mapping and just make sure to include all those good initiatives in their budget as well.
Chairman.
Yes. Committee members,
Some,
you can, raise
Chairman,
questions.
with your permission, just some relevant questions only. I mean, I'm hearing the word like digital harassment and also suicide. I'm under the perception, Papua New Guinea, suicide is very rare. I do not know. You can quantify, from the data you have, like, how many, suicide incident because of this digital harassment or all these things. One, I can ask few questions, then you can, answer it. And again, you said you mainly focused in Port Moresby and Central Province, and Aro, okay. And how do we ensure that this can be also extended to other provinces? Of course, you have a 14-line, online 71508000. So of course, I checked in my phone, it's saved as One Talk Counseling, in my phone. But how do we really ensure? Because sometimes if it is a matter of like just 100, 200,000, 300,000, it's no big deal for most of these members of parliament, to allocate under our DSIP, PSIP, and all those things. So how do we, extend it to the provincial services? The other is like, you mentioned something like you received almost 87,000 calls and all. But how many really productively, we attended to or we really helped and, ensured that the child or women, are safe on that one? And then how do you ensure the confidentiality and safety of those callers, particularly all beginning, children and women? And also, like, what's your kind of partnership with, organizations like police, health authorities, NICTA and all these people? You also mentioned something about, immunization, so how well, in what role you play really, working along with the National Department of Health in terms of, supporting that immunization? Are you also making any awareness programs, like in schools or community and all? Because of this digital harassment, cyberbullying, which are quite new for, many of those people living in rural areas. You also mentioned like it's only majority calls from Port Moresby, like more than 60% calls Moresby, and that's maybe because of communication coverage easily available and all. So how do we ensure that those calls are attended? For example, if you receive a call from Kimbe for some kind of urgency, how are you communicating? Whether you communicating with us or to police in Kimbe, some community development staffs in Kimbe to escalate this information so someone in the province or districts can attend to. I'm thankful, like join you for thanking the government of New Zealand for their continued support. Sometimes it's mostly lack of information. 3 million doesn't sound too big for GOPNG to really appropriate. If that 3 million is helping you to what you are doing and achieving the results of protecting our child and women. So if practically, if you need to continue this program, what do you expect? I mean, I do not know the governance structure of your organization. It's like, you report to who or what kind of, governance structure available so that you can accrete the funds properly and all. So I'm sure, because the members of parliament, if there is any genuine program which are going to help the citizens of, those respective districts and provinces, I'm 100% sure they will very keenly, support. Attend to it. So I'm just thinking, if you're really doing, helping children and women, it's also our responsibility as a committee to make recommendation to government and also make recommendations to our colleagues that you are doing this job and we need to support. And also it's only all relevant questions. I asked about this digital harassment, asked about this governance structure, asked about the funding requirements, asked about some, where exactly you fit in terms of immunization program and all, because it's a very exhaustive program, in as your small organization, how does it fit into, that immunization program? Because you are speaking as an organization for the whole country. Thank you.
Thank you, committee member and Governor for West New Britain. So when I mentioned that the programs, my program is Gender and Protection, which One Talk Counseling falls under. We have program managers for education and health and disaster readiness and social and emotional learning. So they will give their own budget line. The budget I told you about is for operating a helpline, the 3 million. Sorry? 3 million. That's for only helpline.
Okay, other operations, how do you do? I'm just asking, what
Okay.
is your total budget?
Okay, so-
Forget about counseling, that's 3 million if you're saying.
So I need to get those budget line because we have different donors and supporting, yes. So like we have some components of our project where UNICEF supports. They also supporting the Gender and Protection Helpline. We have some short-term support from other donors, the government of Australia, under different programs. So I don't have those information with me right now, but we can share those information. I will send it through email to the committee once we didn't really prepare a presentation for today. So yes. So we're looking at approximately around that between those lines for the whole. So we have programs in health and education program in Arob, West New Britain, Oro Province, and we have gender and protection in East New Britain and Million Bay Province. So that's where we are supporting, strengthening the GBV protocol there, and also support training for the first line responders. So working with the communities as well on the existing mechanism to protect women and children and how they will go through the referral pathways. Yes. So if I answered your question, but otherwise I'm happy to, maybe there so many questions at the same time. I can get what you wrote down and we can email the committee later. In terms of the suicidal rate, I cannot give you the statistics right now, but I can pull out the statistics. So we use what they call a cloud-based data system where the counselors, when they are on the call, just to protect like confidentiality, like you asked, at the call center we have a minimum standard guidelines for operating a call center. And part of the minimum standard guidelines, I'll give you an example. What do you do when you receive a call regarding the child case? The minimum standard guidelines tells the counselors, refer directly to NOCFS, National Office of Child and Family Services, because that's what the Lookout in Pikinini Act also supports and wants to be. So those cases that come, we refer directly to NOCFS. Okay. But right now, because NCDC has the gateway, they're the model for the child protection in the country. They have the gateway unit. We are now referring our cases to them. So anything the counselors know if it comes to child protection issues directly. But we also have guidelines that are in place to protect the data of the survivors that call through. So yes, so that's why it's a workable system. We've been really supported well with Child Fund Australia. So we have technical advisors that on monthly basis we have meeting, and they also provide support to see how our cloud-based system is doing. So, for instance, if a district wants their data, I will go to Salesforce and we will extract it from there. Every call that comes in is recorded on our VRS. They call it voice recording system. Nobody is allowed to go in there. It's in a locked room. We cannot access it unless with the permission of the country director. So these are some of the best practice in place to protect our data. Every call that comes in, the number, the phone number, the how long it goes for, who is speaking and all that is all recorded on our voice recording system. Also, it appears on our Salesforce database. Sometimes, if I need to see what the counselors are doing, I can ask the data team to pull out the exact data, and I will see, oh, okay, so you were working on this day, but there are 4 missed calls. I can know that if they abandon the call. Okay. It will show on that Salesforce database that we use. Yeah.
But who is the boss? Like, who owns this organization? It's like an NGO, but, it's like who founded this NGO? Is it like government supported, or I'm just trying to find out, like, the legitimacy of this organization? You call like Child Fund Australia. Is it likewise Child Fund Papua New Guinea? It's more
Yes.
like a government organization.
Yes, Child Fund PNG, we've registered as a national NGO
Okay.
now from Child Fund Australia. It used to be Child Fund Australia, but we are still an affiliate of Child Fund Alliance globally.
Okay.
But so Child Fund Australia has about 6 countries that we report to, and that's Papua New Guinea, Solomon Island, Timor-Leste, Cambodia, Myanmar. So there are certain countries that falls under those big countries. So Child Fund New Zealand would have Vanuatu and
Okay.
Fiji and others reporting.
So you
to
have your own board of directors or someone who you report
Yes,
to. And
yes.
Okay, thank you.
Can I? Yeah. Thank you. Christine, is it? Okay.
Change
Pamela, sorry. Pamela, I have your contact. Pamela,
Christian Park. Christian Park.
that's the same name.
It's the same name.
Bobola.
Yes.
Okay, so Wanto counseling is a program under Child Fund, or it's a what is it?
It's the only service under Child Fund.
Or in PNG, Child Fund has only one service.
Child Fund has 4 different programs and 1 service.
Oh, okay.
So they have health, education, disaster readiness, social and emotional learning, and One Talk Counseling Helping Line is a service.
It's a service
Yes.
under Child Fund.
Yes.
Okay, that service, is it restricted only for children or for adults too?
Everyone calls.
Oh, everyone
Yes,
comes Wanto
yes.
counseling. So you provide counseling to adults?
Mainly to survivors of GBV and child abuse cases. So and we support women and children, but GBV, not just women.
Men can call?
Yes, of course. GBV doesn't mean it's just women. Men are being beaten up.
Okay,
Yes,
okay.
so-
I hear you, Governor. All right, that's good. Okay, so it's a service. So, Chairman, I'm looking through the mandated function of the National Office of Child
And
Family Services. And there's I think we should bring the director and all these guys together, because we don't need to, there's an organization already doing that. So you have a database system that you are tracking the case management of those guys doing the counseling. So you already have a database system here. So one of the functions of the national office is to have a case management system. So do you think you'll be able to provide that service to National Office of Family, Child and Family Services?
Thank
case,
you.
because
That's our government initiative.
yeah, that's
our
the
government
that's the
initiative.
government initiative, but collaboration, partnership, all these things. I don't think they have a software or database system in place to track those cases, and I'm pretty sure we should have asked them that. So if they don't have it, Child Fund under One Talk Service has that's a system, and they're keeping information for Papua New Guineans. You're tracking it nicely, so why can't that particular function be outsourced?
Okay, thank you.
Or do you think you can be able to provide countrywide if that particular function of case management, especially providing the back-end support for data? Because one of the function is to collect data and present to UN or whatever convention, international convention, and if they don't have a database system or some sort of reporting in place, what kind of report will they provide to these UN conventions that every time they go to? The last time, GBW, people all go, but we are still failing to provide report to GBW overseas. So, what can you provide that service to NOF,
CFS.
CSF, that particular service, because we need reporting to present to international conventions, and if you can have that system in place, that would be a good system for not only child What about GBV, those cases, tracking those case management of all those incidents, na people track him na collective data na just like. So if there is a system already in place that you are using, why can you be able to supply to those to GBV Secretariat and also to NOFC? Yeah, Chairman Emranwego, but we need to bring all of you guys sitting at one table. One table, and we'll ask them that GBV Secretariat and this last. If they don't have a system, why can't they use your system?
Okay, thank you. Thank you.
Do you have the capacity, or you need the capacity to do that?
Thank you, committee member and member for WOW Warea. So in terms of case management, I'd like to acknowledge UNICEF for supporting with in the child protection subcluster committee. We have a child protection case management task force team, and which UNICEF and NOCFS are co-chair. And we've been working the whole year, maybe since last year, this year, on developing the case management forms and system. UNICEF is helping to assist the Office of National Child and Family Services with in terms of case management. The database that you are referring to, that Wanto Counseling Helping Line uses, is for operating a call center and helpline. And this can be, you can just take this service and make it a government service. But personally, I'm not representing Child Fund here when I say personally. I fear just giving this away to NOCFS or whoever that will want to take it in until we see some concrete.
I'm not saying giving.
Not give,
outsource.
Outsource.
That function outsource to an NGO to run it instead of they running it, because their functions.
Yes.
Their functions to under their mandate by law, their functions to do. Why can't we? Can we outsource that function to Child Fund?
They can do that, and they can fund it. And we already have a system. We have the database. Everything is working. They can fund it. The government can fund it, because, like I said, we need that support. If they want to operate the street hotline, street children hotline,
One is a hotline, which we are doing. A case management refers to the children who come into the police center, or they may come anywhere, where they are tracked in a paper base, and that's put electronically into a system called as a Primero system. So they put that data in, and they track to see how the child is treated over the period of time. So that is the case management system any government should have, so that they can protect all the most vulnerable children. Now, the NOCFS has started that process, but at a very small level. So they're starting this process for case management system. In many countries, even the helplines are managed by the government through a different department in their protection services. So if a country outsources, they can. They should have strict guidelines in place, both in terms of the confidentiality of data and then monitoring to make sure that children and the most vulnerable actually get the service. So in many countries, they do outsource certain very specific services, whether it's for elderly or for the most vulnerable. But I think when we do that, you should have a system in place to monitor, track, and make sure that's actually happening.
Yeah, for telephone services, counseling, the case can be started from just a phone call. Yes, so then you can go and track, and it become if it leads into a case management, then from a phone call you can track it and it become a case.
Yes.
So we have capacity issues in this country, structural capacity issues in this country. But if an NGO is already providing that service, that's something that office should seriously look into outsourcing and just providing the funding and you guys, you are not collecting other data, you are collecting power unit data, put it on a power unit data center, wherever they want it to, and all the data privacy, security is lost. But it's the service that we need,
Yes.
which you are providing a service that can be outsourced. I mean, provide to the government, which government can outsource.
Yes, yes, sorry. At the beginning, I didn't understand the, I was thinking more on, you know, government taking ownership right away.
No.
And so I said I fear that it might, otherwise, if you outsource it, if it's been captured on the plan, we are already functioning and we can deliver on this. There is a full, you know, team. Also,
That should also apply to gender-based violence, those tracking of those.
yes.
Taking
So
of those
all our GBV cases are also captured and are recorded in
Yeah.
the Salesforce. Yes. In terms of like, I was listening to what the Simbu team, you know, they spoke about the provincial council. I just want to make mention that we still need those councils. And in terms of confidentiality and all that, the Act also, there are some assessment criteria that we should use when it comes to child protection. You know, you might have someone sitting on the committee that is a perpetrator. And so we may never know. So some form of screening must be done before they become part of the council and all that. Yeah.
Why do you think we should have? I mean, we are setting up the reality on the ground.
Yes.
We are trying to set up committees everywhere. Committees at a national level, provincial level, and district level. So if you look at one district, we don't have the capacity. We will pick, if you, for example, in a district level, if you say you want to set up a child protection committee, or WAS committee, law and order committee, all amas la committee mi bla setim lo district level. So us mane ba bla panim lo when about 50 minutes lo one on committee. This la kind also thinking to time or talking lo create more committee youth council. Committee blo this la committee blo dead la kind committee or like mi bla lo create lo women's kind, you know, they creating church committee. You know, this they formed the act and they see in creating committees is easy for us to run. But when you see what the committees, when you create at the provincial level, they will want bus fare, balance ticket, hotel accommodation, ayaka, lunch. Who will provide those money to them? So it's not feasible on the ground, realistically on the ground level, to create all sorts of committees. So can we match, Governor, through you? Yeah. I'm sitting on different committees and I'm seeing the same problem. So can we somehow, the disconnect in the national policies and legislation going to the province, you mean stack up because you talk provincial administrator lo creating this la one soil protection committee na mo calculative la blame stuff. I me creating usaid me put him this la committee staff la usaid me put him this la committee.
How will I fund it?
How will I fund it? Mane me put him sleep long way lo this la district ya about me maximum come. These are the realities at the provincial level. We'll buy the ticket or we'll buy my car or hotel accommodation. These kind of challenges are there at the provincial level. So before we start creating committees at the provincial level, let's look at existing structures already in place, like the community development office. That is already in place. Can we, and because all pay, public servants, you pay more pennies, yeah? You pay more pennies, so you see more working more work. Instead of me like man outside law system come and said, you have to pay all these things, the administrative stuff, the calculative stuff, so that's the delays because of that.
Yep.
I'm doing at my district level because all like working community law and order, WAS committee, now youth committee, kind of committee, na mito, all got a line come up asking lo sitting allowance. Na mi plak money lo na pay more sitting allowance. National Youth Office pa kam give money lo. Or WAS PMU office pa kam give money lo.
Not like
This the reality on the ground is completely different. You think that you come up with an act and it will work on the ground level, but it's not working. It's not, the implementation on the ground is not. So you have to consult it properly before. Governor Soremos and Presa, you talk about all talk committee belong council. But you have women's council, you have youth council, you have now child welfare council. Now you will have GBH secretary. That's about 5 committees now. If you have 7 members in committees, 35 members. So 35 times. How many allowance you got? Sitting allowance, balus bus fare, hotel accommodation. you think provincial government or Katim Tisla one functional grant blow, where will they get the money to fund those committees? Sorry. Governor. No, not for you,
Yeah.
but also press up lo when running government lo ground level mi kam no to.
Very good, our committee member. Good for us to have just this discussion. It's not necessary for you, Ms. Krisimpa and Ms. Kaupa, to answer it. We're just having a dialogue, and you can give your take. We have the representative from the Department of Treasury here, but before we call them, I want to invite Ms. Kaupa to give us a take on the work that she's doing and how we can improve the work both in the NGO space and also in the government. For us, our responsibility is to make the government work, provide service, all up to its responsibility, be brought to account. And of course, part of it is to support you all in the NGO space. But our principal responsibility is, but government is the principal carry the principal responsibility to provide services to our people. It must honor that. Thank you, Ms. Kaupa.
Let me start by saying it takes a community to raise a child, and it also takes a community to abuse a child. From all levels, all space, different platforms. And good afternoon, everyone, and also viewers, and thank you, Chairperson, and members of the committees of the Special Parliamentary Committee on Children and Youth. Thank you for the opportunity to come here and speak on behalf of the children of Papua New Guinea and the work we do to help them. And to have this forum or platform is very, very special and unique. And for us to come here, it means a lot. I will go just two. First, I'll just take on from what Pamela says about the NOCFS, and then I'll go to the work that Magna Carta and St. John of Arc is doing, and then I'll give some recommendations. First and foremost, also to add on the work of Child Fund Wanto Counseling. Child Fund Wanto Counseling is also a national referral lines for child abuse, child protection, safeguarding, and gender-based violence, serve, rape, all sorts of violence on women, children, men, and boys in Papua New Guinea. And it also stands as a national information hub. During the COVID and coming forward, people used to call Wanto Counseling because they have a national directory, service provision national directory. So Wanto can make referrals. They will tell them, okay, you inlay the Salvation Army there, or Anglican there, or Unagan like this. So that's the very, very important thing that Wanto Counseling plays in Papua New Guinea. And they used to be before they used to be stopping at 7 or 10, and then they will connect to Wanto St. John ambulance. But through the generous support of the donors and partners, they maintain 724-365. That's one, just to carry on from Pamela. And second, the role, function of National Office of the Child and Family Service, they need to know that under that community development has 5X. Yesterday, sorry, the lawyer of them were at the back, but they did not advise the secretary that they are mandated to 5X in that 4X, and now one is a bill, the disability bill, yet to be enacted. So under that, National Office of the Child and Family Service, they're in charge of the legislation, the policy, training, resource mobilization, registering and standards and compliance, training and terms of reference for offering trainings, oversight of provincial, strengthening national system, monitoring, evaluation, reporting and learning, both national and international. These are the roles and functions which they did not play over the last 10 years.
That's that office,
That office, that National Office of the Child and Family
Services.
And one of the simple things that they should be doing is to train the child protection officers, which they should be under the welfare officers in the different provincial level at the sub-national, where they call them community development officer. They'll be multitasking officers. There'll be youth worker, there'll be child protection officer, there'll be welfare officer. They'll be doing this work to support women, children, and disadvantaged in the provincial levels, which they failed, and they should be doing that, and they should be improving. And one of the big things that in the reporting for the last 20 years, they never report CRC. And we should be the same. CRC parked under the office of the Child and Family Service, and they co-ed with technical support from UNICEF and Office of the United Nations Human Rights. They will co-chair the work to actually report, but government must take the first step.
What's CRC?
Convention on the Rights of Children.
Convention on Rights of Children. They're supposed to report regularly to the United Nations.
Yeah, I'm talking about those things.
Yeah. You may work when you start.
No got data, yeah.
No got data, the office is not functioning, there's no reporting. This is the sad reality for 10 years. Anyway, Ms. Kalpa, continue.
So last time when we have the visit of a good partner, the director for UNICEF that came all the way from New York, I was expecting the minister to walk there with a 5-page report to actually give a shadow report of the CRC, but he didn't. When we have eye-level meeting, the minister, the secretary, all the lawyers in that place, please prepare a very good report that is representative of this country and present to our partners. You can't be walking without any report and you just go and stand and talk. It's a high-level forum that we're having here.
And you receive all the funding from the donors and they don't see the outcome at the international level. That's really sad, sorry.
So that's just some work and task and functions of the National Office of the Child and Family Service. Now I'm just 5 minutes. I know people are waiting. Magna Carta PNG, we're a human rights organization, community-based. We work in the area of reporting, protection, education, and awareness on human rights. And under our protection work, we run a safe house for women and children. And in that, we have a program called Supporting Women and Children in the Criminal Justice System. And we're not focusing on the survivors and the victims. We also support the offenders as well. That's where we have program at the prison camp, at juvenile, at Bomana. So there's 2 strong issues that I want to present on children accessing justice. One, the influx cases of sexual abuse on minors, and then also the minors accessing justice and they're going through the criminal justice system. It's very challenging. In September, I actually shared that article, and the civil society, we gathered together for a call of action, and that is on the suspended sentence for raping a minor in Manus. A 9-year-old girl was raped by a 66-year-old man. And the very judge did unfair conviction of that case, and we had a call to action for that. And we're still waiting for the judge to come back to the media to tell us why he was making the decision. That's one. And 2, we have a lot of sexual abuse cases. And Magna Carta, we partner with the Sexual Offense Squad at Boroko, and we support them. They bring the survivors to us, and every day it's like 10, 15 cases, and you have limited Sexual Offense Squad officers, and when they were working on yesterday's, there'll be new one coming in. And there is a big, big concern. And also going through the criminal justice system, some they give up, going and coming. We don't have a different sexual offense track. I know the 2 lawyers are here. They have to go through the courts, the normal courts. So it can take 5 months, 6 months, 7 months, even 1-2 years, and then the little girls, they don't want to continue. Every time you take them to the police station or courts, you kind of re-victimize them. So access to justice for the children, it's a concern. That's one. And then on the other side, for those children offenders, for their well-being, for their transition, rehabilitation at the juvenile jails as well is a concern. So we actually conducted a prison assessment, and I'll just quickly give you the stats. Currently, we have 313 juvenile offenders across the juvenile jails in PNG. And the highest offense that they commit is possession of drugs. And the second highest is armed robbery, and the third is stealing, all class stealing. And so one of our call is to the Department of Justice and Attorney General Juvenile Justice System to work and help rehabilitate the juvenile offenders, and also education department. While they are inside, there is always opportunity to go and deliver some form of curriculum or skills building and training. That's all. I'll give the stats of the first 6 months report, our stats. We conducted 4 trainings of legal protection, and we actually conducted 3 community justice, where we have a total of 1,800 people in total in 4 different communities in NCD. We formed 1 neighborhood watch committee formed at Tokarara, Rakatani area to look after children. They are kind of children protection volunteers. 1 child justice committee formed at Ola Tokarara area. And then we also Magna Carta form a legal pro bono network, and it is co-chaired by Council Rosemary Koimo and one of their legal firm. And 112 female survivors access support at St. John of Arc Safe House. 63 children survivors assisted, 15 male survivors assisted, 62 female survivors assisted with family court matters, and that is including legal interim protection order, permanent, maintenance, welfare, and legal advice. And 4 female survivors were repatriated. And we thank our partners, UNDP, National GVV Secretariat, Child Fund, Friends and Families of Magna Carta, our very good, strong governor here, Active City, also the supporters like MRDC, Santos, and all the other friends and families and like-minded Papua New Guineans that support the work that we do. With that, thank you. Thank you, Chair and the committees.
All right, thank you, Ms. Kapa. I have to manage time. It's a good information we are getting. I'm pleased that these 2 NGOs are here. They can give us some insight into the reality of work that needs to be done. A lot of work needs to be done. I'm sure we have a lot of questions, but we have the team from Treasury here too. So perhaps if there's some real strong question your committee wants to raise, they can raise, but otherwise I will ask them, like, before they take leave, we excuse them, maybe they can give us some recommendation about way forward. How can we improve the work in the NGO space and for the part of the government to really reach out to the children of Papua New Guinea? Yes. Yeah, so, but
I think I've got
our committee member has got a question.
One question. The way things run, it's supposed to be, we have the National Child Welfare Family Services, and then we have the Office of the Director of Child Welfare, and then we have the Department of Community Development, and then with the organizations, the NGOs, all these entities are geared towards promoting and enhancing or trying to promote the interest of our children. And if all the systems are functioning the way it's supposed to be, I think we should have no problem. The statistics that we're having from UNICEF and the other NGOs, I think should have improved. So we seem to have a lot of offices and entities that are intended for the promotion of the welfare of our kids, and I think it doesn't seem to be working. And it's commendable that I think it's good to hear from you two very powerful women talking about things that you're doing in your NGOs, which is wonderful. My only question is, in the kind of work you do you normally get any direct funding assistance from the government through the Department of Community Development? Because you're doing wonderful things that are supposed to be done by the government. That's in line with what the other committee member for what he was saying. Whether this kind of work should be outsourced to, what the government's supposed to be doing should be outsourced to private entities. And the issue of protecting the confidentiality, especially when you're dealing with small kids. And I think Family raised a very pertinent issue in relation to we getting any public servants to constitute to be members of the child welfare on the national council and also on the provincial board. You may be having somebody who is a perpetrator, who's a pedophile sitting on the board. If there's no vetting or no diligent checks on his background, see, it doesn't solve the problem. It sort of exacerbates the issues, all these kind of things. We have government systems, departments, entities that's supposed to be, but it doesn't seem to be working. And that's a matter for us as the committee to, in the recommendations, we will look at it. How do we streamline those government functions, what we can do, what the government can do, what the government cannot do but can be effectively done by, like the organizations, NGOs, and then with the input for support from the international donors, how we can effectively do to maybe 10, 20 years down the line, maybe 15 years down the line, we can raise the statistics. Some of us may not be in Parliament. We're lucky we come back, but that's so my question would be whether or not you get any direct funding from the government, either through the Community Development Ministry by way of subsidy, because you're doing things that the government should be doing, or either direct funding from Department of National Planning through PIP submissions and things like that. Thank you.
Thank you, Honorable Member. Last year, 2023, the Office of the Community Development through the National GVU Secretariat actually rolled out the small grants for safe houses in responding and preventing gender-based violence, and that was through the strong work, robust work that Governor Pakov was doing, the chair was doing over the years, that we have to march and cry that, we must have resources to respond and to prevent. And we started to talk about we must prevent 75% and we must respond 25%, but it never went that way. We are always responding, and prevention is really, really low in the country. And we were happy, and we thank our government that they put up the National GVV Secretariat, and we also pray that they will fund the office so they can mobilize resources to fund the community-based organization, other small NGOs, because the church base, they have a network. The churches are supported by the government. They went through other pathway, but for us, other small other community base, we hope that they will strengthen that, and we thank National GVU Secretariat for actually working their way around to get some money and put it in the pool that they will continue to support us. And we don't want a one-off. We want it to be continuous support and funding. And if you see, a lot of work are done by volunteers that are in the community where all these things are happening, and they are with the people. And it's for the community development through the National GVV Secretariat to liaise and talk with the key government agencies, how they can pull funds to support us. And I think different NGOs have different partners within nationally and also outside of the country. They have partners that they support them. And also one strong support that we receive is from the Australian government. Like they have the PNG Women Lead and Australia PNG Law and Justice Program, APLJ. They also support GVV and SAV as well. European Union, all our partners are at least giving some form of contribution that, strengthen the work that we are doing. But we want more prevention than response. We need to prevent it from happening, whether we prevent it through the curriculum within the departments and Office of Higher Education. We need to prevent at the community level. We need to talk more that the pastors and the preachers need to talk about it than talking more about Bible. I'm not saying that preaching Word of God is bad, but, practical teaching and learning. In the little communities, wherever we are, we need to bring the message of prevention, child abuse, or GVV, or legal awareness, legal aid, HIV, integrate all these things, and you go out to different schools, communities, and you tell them so we can prevent them from happening.
All right, thank you, Ms. Cooper. Perhaps you two can give a reply to my
Yep.
the general question about how do we, from the NGO perspective, how do we move forward in terms of addressing the challenges our children face, making the next 50 years perhaps greater than the last 50 years? What profound intervention should we recommend to Parliament? Yeah.
Thank you, Chairman. I think going forward is, all these good initiatives cannot be left unsupported. Eventually, some of the small CSOs will die out, donors will go, and we will remain as Papua New Guineans. So a proper regional consultation must be done to map out the existing stakeholders and what they are doing and how that can be captured in the budget. So we have challenges. Some CSO, some NGOs find it easy to access NGBVS. Others, it's almost impossible, even if we set up for meetings, but also with NOCFS, if there could be regional consultations done, map out who's doing what in each of the regions and what they are doing and how that is aligned to the functions they perform. Because obviously we have a treaty that we've signed and ratified. We've put our hand up as a nation to the United Nations Convention on the Rights of Children. And we now have legislations around it, which is the Lookout in Pikinini Act. And so we need to, now that we have an office in place of Child and Family Services, we need to ensure that all these different key stakeholders who are now being mostly supported by UNICEF in country, and maybe some others like Child Fund who are supporting in small ways, we should be captured on that map, and so that funding, the good initiative must be included in the strategies of this good office. And from there, funding allocation and support us on an annual budget, and maybe eventually take on all of this by outsourcing to those who are already doing it. We can become service providers, or we could be just government, but we are operating independently, providing that service, and we report back. On that, I also want to mention with Child Fund, Wanto Counseling, we have a data sharing protocol. We would love to share data for your district and your provinces with each of the members of Parliament to see how you can also support at that end as well.
Thank you, Ms. Krisimpa. We appreciate the offer you are proposing to us, and I would, on behalf of the committee, ask you all to submit the data so we can share with all the members of Parliament. It can give them a reflection on the challenges, at least from that perspective, in their district, so they can also factor it into their plan. Ms. Cooper.
I think everything has been said by Pamela, but one other thing is strengthening the engine room, which is the Office of the Child and Family Service, or National Office of the Child and Family Service. If they can at least do, an internal audit of the skills, knowledge, and attributes of people that are working in the office. And then from there, it will give them, who is actually have some specialty or some knowledge about certain things. so that they can do their work properly and accordingly. And this is the engine room for the children in Papua New Guinea. Thank you, Governor.
All right, I want to,
Competency.
on behalf of the,
Let me ask one last question. This is not related to child welfare, but your counseling services, can you take another road like hotline or something?
Yes.
For, not only for counseling, but for like reporting a health emergency, disaster, law and order crime that takes place, you know, can you take on added roles like that? This, because this is something that my district will be willing to look into.
Okay, so we've offered to the street children, because we can replicate the same type of program. So the calls that come in, they cover all different aspects, but like our focus is on GBV, survivors of GBV, and women and children who need protection. But we get like an information hub, like Shelley mentioned earlier. We have different calls, like people just call in to find out where the hospital is or where that school is or where. So so we have a directory, and that's how we reach out to our service provider directory is being updated every 6 months. Some of the support, I want to also thank our chairman and Governor for NCD for the jingles that you supported going out already, and the directories that will be printed. We've just updated, completed the update in September, so it should go down soon for printing. Yes, so some of these, most of the different topics, people just call. Sometimes we get even perpetrator calling in and they just swear, but we have a system that can screen. So when perpetrator call again on that same number, an alert comes on. So sometimes we can let it pass, or we just block the call. Yeah.
thank you, Ms. Krisimpa, Ms. Kaupa, thank you for your attendance and accepting my invitation on behalf of the committee to just appear on an improper basis. But you have done well in terms of the exchange and enlightening us on the work that you are doing. On behalf of the committee, we want to thank you all for the wonderful work that you all are doing, and I encourage you all to keep on going, and hope that our committee can help you all in the long run to come up with recommendation and intervention that can get government to come into alignment with you all, and we work together. So thank you very much for your attendance. Thank you.
Thank you.
Thank you, Chairman, and all the committees.
All right, it's 1:07. We have indeed passed lunch time, but we have the team from Department of Treasury here. So I will invite them to come, and we will keep the proceeding short. Yeah.
Not plenty of questions.
Not plenty of questions. Please, lady and gentlemen, whoever is the senior officer, take seat first and introduce you twos. And we won't necessarily take a long time. Who is the senior among you two? Yes, thank you. Please introduce yourself, and you introduce your colleague, and then we will get into it.
Good afternoon, Chair and committee members. My name is Marian Maspok. I'm the First Assistant Secretary for Budget Coordination. And this is Larry Asigao, who is the Assistant Secretary. Chair, on behalf of our Secretary, Mr. Andrew Oike, we sincerely apologize for not attending yesterday. And also today, he has prior commitment, so he asked Larry and myself to attend. We were called from another meeting, because this is our budget process period.
Yes,
so
yes.
We were in another meeting, and we were called to attend this meeting. So we came here without prior knowledge of what to present today, and we were informed of what we are gonna be more like answering today. So we don't really have the data or the presentation to present to you. We understand that the children and the youth of today are very important resource for tomorrow's future leader and the development of our nation. And we want to have all the data available to present truthfully to what the budget has been for them in that sector. We realized from the questions that we're going to look at the health, education, wash, and nutrition. So it's cross-cutting in sectors. So for us to pull that data, we have to go into various data, and we don't have that information with us on hand. And we kindly ask if you could reschedule us, so when we come the next time, we would have that full information and the presentation to do to you and your committee members.
Yes, thank you, First Secretary. That's exactly what I intend to do. So this is why I say it will be a short session. I, on behalf of the committee, accept the apology from your secretary, Mr. Awayeka. I understand he was attending another session or meeting yesterday, and today I had to remind him about the invitation to come before our committee. Just by way of a background, the committee is a new committee. It's a special parliamentary committee, so its life is only as long as this parliament. It's not a permanent committee. So we got 1 more year or 1.5 years to go. So our intention is to maximize the time and opportunity that we have a life in this parliament. Maybe in future, the next parliament, the 12th parliament, might make this committee a permanent committee. That might be our recommendation to Parliament. But for now, the Parliament has made it very clear by forming this committee that we must focus and invest more in our children in order to give them a stronger foundation in all aspects of life for the future. But importantly, the indicators that are important for the children, their health, education, safety, and in respect of that, we are emphasizing on immunization, because immunization ensures that they are protected in their entire life journey against this common virus, tetanus or polio or measles, or those type of. There's a long list, and I'm not a medical doctor to understand and remember all the viruses and the vaccination. So that's one major area that we are focusing on. Another, of course, is in the area of nutrition. A lot of our children nowadays, maybe half of them, 50%, are being affected by poor nutrition, and it's affecting their physical and mental development. Some are, getting malnutrition, and some also equally of concern is getting stunned. So stunning meaning that they are not fully developed mentally and physically to their potential. So this is a major concern for the Parliament, and our committee has oversight over this area. So we are going to inquire and get all the relevant government agencies, provincial government, local level government, to account to tell us what they're doing and how they need to ramp up their effort in order that we overcome this problem of stunning or poor nutrition. We also have oversight of our beds registration. What is that office? National Civil Registry. Yeah. So far, I think it's about 13% or less than 20%. So that affects the children and their future, because their birth certificate, gives them identity, enables them to have access to NID and passport and driver's license and bank accounts and you name it. It's a defining sort of intervention that must be rolled out 100%. We must ensure that the children, once they're born, they are given a certificate and they know their date of birth. Because sometimes their date of birth is critical in sports or in their health too, or if they're getting medical attention. Doctors want to know when they were born, so they can give them appropriate treatment or care and so on. So many other factors are affected as a result of that. Education too, we have a big problem with education. You two probably know, everybody knows. We have about 85% enrollment at elementary, primary, but going to secondary school, and Pundown, you got 20% here. So where are our children going? What is their future if we continue this way? Yeah, we all know too that going up to tertiary level, only about 5 to 10% going to tertiary level. So these are challenges we face. If we are going to secure a better future, brighter future for the country and our people, our nation, it starts with the children. So the Parliament is making this very important statement. We are going to reset in so many sectors, and we'll start with the children. Because these last 50 years, I'm life blooming now, whether we are 50 or over 50, or that's our life. But between now, 2025 to 2075, the next 50 years belongs to our children. And so what you all do at the bureaucracy, and we all do and decide at the political level, will define their life. So we all have this responsibility and opportunity. And there's a lot of other sectors too that need intervention that we must address. So our committee has this terms of reference and responsibility to have this oversight. So we are going to bring all the government departments to come before us to tell us what they're doing, how they can ramp up, and we are going to bring them to account to do more. We must do more. So yesterday we had the Department of Health and Department of Education, Community Development, planted something on the Wokim here. And now we had the Simbu provincial government. All the provincial government, number of provincial governments supposed to come, but all not come today, so there's a bit of disappointment on our part. But this first inquiry, I decided on behalf of the committee that we will send an invitation. But the Secretary and Assistant Secretary, I want to remind you too that Parliament Committee, under our standing orders and of the Parliament, we have powers to summons witness to come. So I don't want to resort to power of summons yet, but if provincial government and other agencies of state don't respond to our invitation, then I have to compel them to appear, because we need this report to come forth so we can present national picture, provincial picture, district picture to the entire Parliament and people of Papua New Guinea, so we all can work together to change the dynamics. So at this time we are going by invitation, but I want to use this opportunity to give a notice to all the provincial government that the next time I will summon the provincial administrator and even the governor, I will summon them to appear. And if they don't appear, then the penalty here in terms of accountability is that the Parliament has the power to, our committee has the power to recommend contempt of Parliament, which is a semi-criminal offense. They can be charged by the Parliament and be fined or be subject to different type of penalties. The committee in Parliament that preside over, I think it's a privileged committee. They got wide powers to impose, other sort of penalties. Cut and pay or whatever they want to do. But that's not my prerogative. I'm not threatening you to. I'm just talking about the powers that we have, and it applies to everybody. Let's all come together and think about our children. That's our important message. So coming to a short sort of a dialogue with you two. Thank you for making time. Thank the Secretary for even at this last minute reaching out to come. I think we have only, on behalf of the committee, only one or two things I want to raise with you all. First, please, there's 5 questions, so we would appreciate that you all respond to it as soon as possible. Give us a written reply so that it can form part of our reporting to Parliament. We need to start compiling report to Parliament as soon as possible, because some things that we had yesterday, for example, principal agency to reach out to the children, the office of what is the name of this office?
National Office, Children and Family Services.
Yeah, it's a bit of a mouthful. National Office of Child and Family Services. It has come into operation in 15 by virtue of the Lookout Pignini Act, but up to now, they've not done much, virtually nothing, and that's a, really big sort of a dent or, poor testament on our part and effort to reach out to children. It must change. So please, answer those five questions. Any other information to you all can offer to, we would appreciate it. Submit the reply as soon as possible, so if we want to ask for more information, we will follow up with you all, or if we want you all to appear before the committee again, we will do that. The final request that we want to ask on behalf of the committee, and I think everybody wants to know, is that Governor for Simbu came before us today with his team. They presented a very comprehensive report. They prepared well, they came and they presented, and it's a credit to the Governor and the Provincial Administrator and the CEO of the Simbu PHA. They responded, they know what was expected by our committee, and they came and delivered. And they want to show what they've done and achieved in Simbu Province for children, but overall plan and outcomes there for our province there. But at the same time, they highlighted the challenge that they face. So one big challenge that we want to raise with you just now, which you can respond now, is that it's on everybody, all the governors and members sort of mind, and the public wants to know. Their situation in Simbu province is that last year they only received about 40% of their functional grant. And this year they are just reaching about 30%. No, 26. It's 26 now. And now it's October. So this is a pertinent question, because the funds is the bottom line. It is an enabler to everything. Children, women, youth, church, infrastructure, education, health. So if the funds are not going to the provinces, himba also when him now, the comment that we have and the governor aired is that we are just living on the grace of God. Like, people could be dying now, but lucky maybe they are not dying to the extent that they could be dying. So, it's just by the grace of God, but we can't rely on that. As a government, we cannot rely on that and just leave our people to the grace of God. God, as we all know, gives us miracle very rare. We hope God gives us miracle every day, but it's very rare. Apart from life itself, giving us other, social economic outcome, like it's very rare. You have to pray a lot before, and a lot of effort before maybe you can get some miracle from God. So we can't leave our provinces to that type of dilemma or situation or dynamics. So what our key question, and we have two governors here. Governor Wesley Britton, he seems to be a committee member and also a participant in this, inquiry as well. So I can't stop him. So I think that's the pertinent question that everybody wants to know. How are we going to honor the functional grant from last year and the functional grant from this year? Are we just going to leave the provinces to their own device and they do whatever they want to do? You got money or no? I think that's all. Bottom line. You two can answer it now, but if you can't answer it now, Secretary Oikam, has to announce to everybody about where we are now. Thank you, First Secretary and Assistant Secretary.
Thank you, Chair. In terms of the cash flow situations, the medium-term, mid-year expenditure report have shown that our revenue has declined, and it's probably affecting our cash flow. But probably I'm not the right person to elaborate on that. I will leave that to departmental head and probably a treasurer to elaborate further on that. So
Okay.
our media report has stated that. So, like I mentioned, chair and the committee members, I probably allow the departmental head and the treasurer to elaborate further on this.
Yes. All right. First Secretary, I'm not sure you can elaborate more on that. You're not probably the right person, but I thank you too for coming here, so at least we can give you this question. It's a very pertinent, critical question. It's not just this committee, but I think all the governors want to know, and all the provinces want to know. So we can, you know, probably adjust all our plans, so they can adjust their plans. So you all can bring this
Yes.
question to the secretary. I'll send it to the secretary too, Secretary Oika, and I will, of course, send it to the treasurer too. I agree with you. It's the treasurer's responsibility to come before the committee, and we did invite the treasurer to come before the committee with the secretary. Otherwise, unless our committee, you all have any
Thank you,
question,
Chairman.
otherwise I will excuse them. Yeah,
Not a question, but just a
comment.
comment.
Yeah.
Since yesterday we did inquiry, most of the issues that the committee have identified is pointing towards finance. So that's why we have called you. So in your absence, the Treasury and Finance Department's absence, it seems that everyone will be blaming you, so you have to come. It's fair that you have to come, and then you also justify yourself why. Because we have identified that most of the issues, it's all to do with finance and pointing the finger to Finance Department and Treasury. So I think, Chairman, from what the committee have identified, then we can also summon or call upon Finance and Treasury Secretary to come, just for them to clear themselves out on this one, or to address this issue where all other sectors have highlighted about finance. Then it will be fair for them to come and address to the committee and to address this issue. While addressing other issues, the main issue that the committee have find out or have had in this inquiry is the financial issue. So I think my suggestion, Chairman, is that if there needs to be a special inquiry during Parliament session, then we can put during lunchtime, and then ask the relevant departments to
Ministers.
yeah, and ministers and secretaries to come and present themselves. Yeah, thank you.
Yes. Thank you. Yes.
Just
Go on.
one point only. Like, thank you. You took thank you, Loipla come after chairman sent a message to, I think, Treasury. Just like, usually the Treasury releases, the reports. Sometimes they even put it on newspaper. How much of functional grants you have released for provincial governments and PHAs. This morning, of course, the Chimbu governor, I can vouch for ourselves, for West New Britain, and the Chimbu governor was raising the same concern. Even for PHAs, like I do know, for provincial governments, the treasurer says that he releases warrant in advance, almost like, even the 100% warrant. When we check with finance, they always say, Chairman, we are as good as the warrant. But in this case, why even the provincial health authorities, funding is not given? And what is the real priority? How come the warrants for Connect PNG or cash for Connect PNG can easily go compared to the provincial health authorities, warrant? Even one of the planning manager was saying, it's a government priority. Is PHA is not a government priority? Is functional grant for provincial government not a functional? Because the functional grant of the provincial government, which includes like, education, health, transport infrastructure, law and justice, lands, law and order, and one of which under health is, it also includes teachers' leave pay. for constantly depriving, not paying, full allocation or appropriation, then we couldn't, really give that actual teachers leave. And it's keep accumulating, and they are saying we owe teachers like more than 40 million or something. In some cases, we did not pay the teachers, like the teacher's salary itself is also outstanding of some big amount. Provincial government, you know very well that we fully depend on national government, like, Waigani. It's not that Waigani really generous enough to self-empower provincial government, to generate income in our own provinces where we can, also fund it. Except the chairman's place like NCD or Leh City Authority, where they get like GST like 400, 500 million, whereas we get less than 20 million kina, per annum. It's really difficult to sustain. So just that one. And can we get some assurance that these reports can be released, so that we can't just assume or predict. So you can also come with confidence. No, you are saying not paid. You are saying only 20% or 30%. No, this is the money paid. So at least you can counter that information, because that's one of the big challenge. The other thing is how Treasury warrants prioritize between national departments and provincial governments when there is a limited cash availability. You just mentioned that there is some limited cash availability, and there is likely what you call supplementary budget and all those things. And also, does Treasury have any monitoring mechanism to track how provinces are utilizing the functional grants? Of course, our main concern is related to PHAs, because that's where we were talking about child and women, health and welfare and all those things. So I think this is relevant concerns raised by almost every department, every person who were presenting. Thank you.
All right, Governor and committee member, Assistant Secretary, yeah, and Assistant Secretary, no.
Yes.
Deputy Secretary and Assistant Secretary. I will not. First Secretary and Assistant Secretary. I will not ask you to reply to that. It's just information or concern that has been expressed by our committee member and governor, so you can take it away to digest it and hopefully help the Secretary and Treasurer to reply. So because you're not in the right position or have the mandate to respond to that. It's just the information you have, and it's just legitimate concern of our committee and the broader, provincial government and all the subnational governments. Yeah. Otherwise, if you have a comment to say, you can say it. But otherwise, I'll close our inquiry now. Yes.
Thank you, Chair, and the committee members. We note the concerns raised regarding the cash flow issue. Like I mentioned earlier, our revenue dropped by around 1.1 to 1.2 billion. So that really affected the cash flow. So the concerns raised here we will go and advise our treasurer and our secretary, the departmental head of the report, if they could publish it. Otherwise, when we respond to these 5 points here, probably we can put, say, a paragraph or so regarding the cash flow and the issues affecting the disbursements of the funds.
Yes.
So we can provide that in the report as well as an additional paragraph or two, so below the 5 points that have been here, so we'll provide that report as well. So we are, thank you for giving us that opportunity to come back in writing, because we didn't have all the information or we prepared to do the presentation. So we are looking at either by this week, Friday, we should get the report to you, or early Monday or Tuesday next week to get
Yes.
the report across. It's the matter of just pulling the data across the sectors and putting in the narrative behind the numbers and getting the data over.
Yes, thank you, First Secretary and Assistant Secretary. Thank you for appearing before our committee, and I on behalf of the committee, appreciate your presentation, and hereby sort of excuse you all and release you all from the committee's hearing. Thank you.
Thank you.
With that, committee members, our technical team and ladies and gentlemen, our media too. The other provincial government were supposed to appear have not appeared, so I will take my privilege as the chairman to bring our inquiry for yesterday and today to an end. I want to thank everyone, our committee members, for your time and effort and coming in to have this inquiry, very important inquiry. We've made a good start. I want to thank UNICEF and our team from the United Nations for your technical support and working behind the scene to get us to start the inquiry and especially also set up the committee. I thank the Parliament, I thank the government too for allowing this committee to be created and start the focus on children, our children for the next 50 years, and all the other stakeholders who have participated, our two NGOs who have appeared. Thank you everyone for today, and of course our Secretariat and the team in Parliament. With that, our meeting is brought to a close now. It's 1:35. There is a lunch on the other side. Committee members, we have lunch at the back, so thank you.
All right.